network has been
I need
somehow.
to go
Network has
actually.
been having network issues. But once again, I want to welcome everybody. You are welcome. You are welcome. I want to welcome you to this
Okay, okay, this one
our
network.
mental health awareness course. Please, everybody, except you are told to talk, please mute your mic, please. Please mute your mic.
Ticket to 10,000. Now come up
Please,
fix. Yeah.
Madam Modesty, please. Hello, hello. Are you still with me? Hello, everyone. Hello, everybody. Hello, everyone. Okay, let's go on. So, due to network, we are behind schedule, but thank God we are able to meet up. I want to welcome you again to this mental health awareness course. Actually, the program is free of charge, but for those of you that are interested in getting the certificate, we just charge a token of 10,000 naira. If you look at the schedule over there in United Kingdom, this program goes as much as 150 pounds. But we have decided to cut that out and we just give you at the rate of 10,000. It's optional for those that are interested. Thank you so much. You are all welcome. Now we move ahead. Whenever we have a vehicle, there's always somebody that has to drive the vehicle. The vehicle does not drive on their own. So for today, we have somebody that will facilitate this program for us, this course for us. The remaining 3 hours, less than 3 hours, there will be a person that will facilitate this program for us. Now, I want to introduce the person. She is a distinguished professional in the field of education, mental health. She is known for her passion and expertise. With over 2 decades of experience, she has excelled as a teacher, a consultant, and a mental health specialist. She is a registered member of several prestigious organizations. She has collaborated with renowned institutional consultancy firm and institution as we have like MJB Management and Integrated Services, American Institute of Oil and Gas Technology USA, Blessed Cosmopolitan College UK, and Andy Smart Solutions. She holds a degree in English, also in psychology, and she has a master's degree in English and Literary Studies. She's also a certified trainer with USA and holds a correctional behavioral health certification. Ladies and gentlemen, I want us to welcome our facilitator. She's none other than Dr. Mrs. Dorothy Kingsley Tugudo. Dr. Mrs. Dorothy Kingsley Tugudo, you are welcome. Good evening, ma.
Hello, good evening, everyone. Hello, can you hear me?
Good evening, Ma. You're welcome. Good evening, Doctor. You're welcome.
Thank you so much. I think we're all asked to mute ourselves. I think muted from you over there. That's why I couldn't respond immediately you talk. So like it is my tradition, I'd like to talk with the participants and relate with them a little before I delve into what we have for today. So please, I crave your indulgence, if it's possible, to give them the opportunity to unmute their mics, because I'm going to ask a couple of things from them. I'm going to require them to do a couple of things for me. So thank you, MJB. I don't know if that is obliged. Because I'm finding it difficult to know whether, please, can everyone hear me? Are we together?
Yes.
Okay, thank you. We are about—
yes, we can hear you.
We are about 36 people on this platform. So those that have attended my trainings know that I like it to be interactive. But the only disadvantage of that is if the participants would not want to go as we should go. So please, I crave your indulgence. I'm adding my voice, lending my voice to what MJB said. Please, let's mute our mics as part of the rules for today's training to ensure that we don't have obstructions as we go, because we have 3 hours, less than 3 hours to go. So we just have to move with the time. So thank you for the anticipated cooperation from you. Good evening, everyone. Once again, it's nice to be here. I trust we've had a beautiful day. I need to find out, have we all had a beautiful day? Please, I would like to hear your responses at this point.
Yes. An amazing day.
We have had a very beautiful day so far.
Okay. I pray network does not obstruct us. So today, we are going to be looking at mental health. Now, mental health is actually a topic that I'm very, it's a course that I'm always very passionate about to present this course. The reason is the passion comes from the fact that I have had a couple of experiences that has really made me passionate when it comes to mental
1 hour.
Health talks or courses. It gets me all passionate about it. So today, I would be happier if I get to hear you respond. I get to hear you share your experiences. To be very candid, on mental health awareness programs, we don't actually do it one-sided. So it's not all about me. I'm going to learn a whole lot from you because I need to gain experiences. I have to hear you share. So please, I crave your indulgence. Even if you have the phobia for speaking, because a couple of people have phobia for speaking on trainings like trainings, kindly ensure that you type something. You just type maybe or whatever you want to share in the chat box. I'm going to be looking at it. So without wasting time today, we want to look at mental health awareness. Now, in Africa, when people use the term mental, up until now, in Africa, I think I was lost at a point. I don't know. Please, can you hear me? Can you still hear me? Hello, please, can you hear me?
Yes, we can hear you.
Yes, we can hear you.
Okay, thank you. So in Africa, I got involved in mental health. Maybe I studied psychology up until I became very, very involved. When I hear mental, the first thing, or mental health, the first thing that comes to my mind is the picture of a madman. That's what comes to my mind when I hear mental health. The first thing that comes to my mind is a picture of a madman with dirty dreadlocks, hair, moving around naked on the streets. We all know that man. Most of us in Africa, we all know the man I am talking about. So growing up, when you hear mental, oh, you run away because you just associate it with that picture that I'm talking about right now. Know this man, and our parents warned us about him. Our parents warned us. Yeah, our parents tell us not to go close to that man, because if we as much as move close to the man, we are going to become just like him. And they tell us, when we ask them, why is this man walking like this on the streets? We say, our parents tell us, it's drugs. You see, he has been abusing drugs. So if you as much as go close, very near drugs, you become just like him. And they tell us these things. Yes, that is the picture of mental health. You know, mental, when we say mental, that is what comes to mind, you know. And when we are told that, we become afraid of such people, we become afraid of any scenario, any setting that we hear mental, it puts us off. So come down to pneumonia. Maybe you have pneumonia or you have malaria. Your parents would rush you to the nearest hospital for treatment. They'll just rush you to the nearest hospital for treatment. But just there to declare that you have depression, or you have anxiety issues, or you're afraid of one thing or the other. Just declaring that. And the next thing is your pastors will be casting and binding the demons and make sure they send it out of you. That is our African setting. All right, so as I was saying, now our pastors, if we say we have pneumonia, we have malaria, it's very easy. Our parents will rush us to the hospital and ensure that we are taken care of. Having depression or having anxiety, it becomes an issue. Especially our mothers will be running helter-skelter looking for the pastor to deliver us. So it is in Africa. Oh, I just sorry for that break. I had to see as much as possible. I wanted to change my network provider. That I have successfully done. So please bear with me. Before I really delve into what we have, I was about starting with a story. But let me share my screen and understand. I need to understand if everybody can see my screen first, because it's like network is trying to just play some little games with us. So let us see how that would work. I have shared my screen at this point, so I need to understand whether we can see. Need to be sure that we can all access.
From my end, thank you.
Yes, I can see from my own end.
Okay, all right, thank God for that.
Yes, I can see it too.
Okay. So as I was saying, thank you for the response. You see, I like to hear responses so that I can keep moving, and then we all keep moving. So like I was saying, Africa, with the way we handle mental health, anything that has got to do with mental becomes a problem, because we have our religious beliefs, we have our spirituality, we have a whole lot of things. And up until now, there are so many people that do not believe in the fact that there is something like mental illness. They don't believe it. They just feel that when someone begins to exhibit some of those characteristics, it's assumed that the person is either a witch, or the person is being attacked by a witch, or your village people, wherever they are, have finally caught up with you or caught up with the person that is involved in that. So these are the things that we are, hence this course. This course is very, very important. People don't know it. I'm surprised we have over 400 and something people on the platform of mental health, but to my surprise, I'm just seeing about 35 or 37. Why? Because still we are seeing how to struggle, how to deal with creating as much awareness as possible for people to understand everything about mental health and what to do about it. So it would have been a beautiful forum for people to get to learn a whole lot of things concerning this. But nevertheless, I congratulate those of you that are present here on the platform. So as I was saying, according to World Health Organization, what is mental health? We have, this is mental health awareness. So what is this mental health? That's what we are going to look at. This training comprises of 4 modules: introduction to mental health and mental illness, depression and its treatment, anxiety disorders, and suicide. If you look at the course outline there on now, mental health is well-being, where you feel well, where you feel able to do your spirit, soul, and body, everything put together is okay and fine. That is what mental health is, according to World Health Organization. So it also refers to a state whereby you are able to cope with the normal stresses of life and work, everything put together. If a person is able to cope with, maybe you're a working person, you're a family man, you have your spiritual church activities as well, everything that makes up your day-to-day affairs, you are able to handle and cope with it. That is a situation you can say the person is mentally healthy. Now, it also refers to the emotional and psychological well-being of a person. That is mental health. Is that person emotionally okay? Is the person emotionally strong? Those are things that constitutes mental health, your well-being. So globally, like in the whole world, globally, 75% of all mental illness, cases of mental illness, can be found in low-income countries, just like in Nigeria. Especially now, we have issues of mental illness, like in the increase. Why? Because of the situation of the country, because of how things are. So you see that many people now use that fact and intertwine it with already existing issues, health challenges that they have, and you can understand what it means. So this issue of mental illness or mental health is actually really affecting low-income countries that are struggling, struggling to feed, struggling to take care of themselves, and so on and so forth. So, and having said that, most African countries invest less than 1% of their healthcare budget in mental health. You can see how poor it is. In the entire budget, just less than 1%. That is what is invested in mental health. That tells you that we still have to create more awareness. That tells you the level of importance that mental health is to the government. So it is important that we are mentally healthy. We do the things that will keep us mentally sound, our well-being, our entirety to be sound, to help us cope with the normal stresses and the day-to-day activities, psychologically, emotionally, spiritually, in all aspects of our life, we should endeavor and strive to be mentally sound. Now, we are talking about in Africa. Of course, you cannot compare Africa with America, especially in West Africa. Now, in this part of the world, we have severe shortage of psychiatrists in Africa. That's one thing I want us to understand. That is why so many people they are not aware that there is something called mental illness. They are not aware that they should strive as much as possible to deal with anything that will stand in their way of becoming mentally healthy. Anything that will tamper with your health mentally, please do away with it. We have seen people have real problems in this training. As much as possible, we are going to see how we can cope with these challenges and we can see how to guard against our mental health being affected. So in Nigeria, it's estimated that we have about 200 psychiatrists in Nigeria. If you are in Nigeria, we have about talking about Africa is over about 200 million population, and we are looking at just 200 psychiatrists. Tell me, how do you think that is going to work? How would we readily have help for people that are mentally ill? That is what I want us to look at today. Now, in all of this Africa, 90% of our people lack access to treatment. They lack access because there are very few psychiatrists, there are very few psychotherapists, there are very few psychologists, there are very few people that actually deal mental health nurses. There are few. Many people don't many people don't move into that field. There's already a stigma attached to that. If you say you are a mental health nurse, or you say you are a psychiatrist, or immediately and automatically, there is how the society looks at you. There is the mentality of people looking at you if you say you are a psychiatrist, So we have just 200, and people lack access to treatment. Again, because they don't know what to do. They suffer in solitude. Many people pass through mental illness. They have mental illnesses. They suffer from depression. They suffer from anxiety. They suffer from schizophrenia. They have bipolar disorders. They have autism. They have dementia. They have a whole lot of these illnesses that are mentally related. But they cannot access help. They cannot access treatment. One, maybe because of financially, they don't have what it takes to go for therapy. Secondly, they don't have the awareness. Hence, we are doing our own bit to create this awareness. They don't have the awareness. They don't know what to do when they are faced with those situations. So we as Africans, especially Africans, we are used to stomaching challenges. We are used to, especially the men, they are used to bracing up and bearing their challenges as a man. Because to them, owning up to some of the challenges they have, owning up to the fact that they are depressed, owning up to the fact that they have anxiety disorders, is going to attack their virility as men. It's going to attack, an African man is used to bearing whatever challenge he has. Full, that's facing it squarely. They are not used to being vulnerable. They are not used to showing the other side of us, because already they assume that the two goes together, that once they show their vulnerabilities, attacking their manhood, as in is attacking them as they are men, not only men, women, vice versa. So these are some of the things that we need to understand. So mostly in Africa, when people are faced with these things, they are silenced. They live a life stigma. They are scared. They are afraid of what people would say. They are afraid of being tagged as the madman. They are afraid of the get treatment depression when they know that they're passing through a bipolar disorder, when they know they're having one mental illness. These are things we should look at. So practically, mental health has got to do with maybe got to do with, you know, attacking their manhood, or maybe attacking their virility as men. These are things that are very, very important for us to take note of. All right, so at this point, I don't know, like I said, I hope that we are together. Please, can everyone hear me? If you can hear me, kindly just let me know in the chat box so that I will know that we are all together, because it's like network is just trying to be very,
Yes,
very
we can hear you. We can hear you.
Yes, ma. We can hear you, ma.
Thank you. So as I was
Yes,
saying, you see, network has fluctuated. Bear with me. Once there's network fluctuation, it affects my screen. So I've just returned it now. I guess we can all see. So as I was saying, please, this is a forum. I'm so grateful to MJB Management and Integrated Services for this opportunity. Like I said, I'm always very passionate about mental health. So when we are facing one challenge or the other, seek for help. Do not in any way think that it's going to attack your virility or it's going to make you less of a man or less of a woman. That is why we are beginning to be aware today. So let's look at some of those things, some of those tips that can help us to deal with our mental health. Some of these tips. We should try to relax and reduce stress. This is let's look at, these are some of the things that really help us. Try to relax and reduce stress. Yes, I know we're looking for money. I know we have to take care of our responsibilities. I know we have our families and we have a whole lot of things to do. Yes, especially with the situation of the country. But it is important for us to note that despite all these things, that priority should be your mental well-being, to take care of ways that you can learn and be creative. Find ways to learn and be creative. Think of ways that you'll be able to move forward, to relax. Spend time in nature. There are some people that actually feel good when they go out, maybe especially the whites, you know, our own part of the world. We are not particular about all these things. But when you go to UK, you go to US, you go outside the country, you find out that a whole lot of people like to maybe sit down outside, just take fresh air, look at nature, look at the skies, look at the stars in the sky at night, look at things. These are things that help them to remain sane, to help them to remain, you know, to look out for their well-being. Connect with others. Don't be an island. Don't be man alone. Connect with others. Join organizations. Belong to groups, mental health groups. Belong to groups that will build you, that will help you. Look after your physical health as well. Try to improve your sleep. These are some of just a few tips that you need to know to help you to improve your mental well-being. All right, now we are delving into mental illness. We've talked briefly about mental health, how we are able to cope with activities, being strong, being agile, doing your work, finishing on time, maintaining balance, your emotional balance, your physical balance, your psychological balance, everything, maintaining it. Yes, that means you are mentally healthy. That is what it means. Now, there is another part that we'll really delve into. You are going to be hearing us talk more, because that's the part that we really have to hammer on, which is the mental illness. What is mental illness? Like I said that before, when we hear mental illness, we automatically have the picture of the madman there. But that's not true. It's not all people that have mental illness that actually move on the streets, maybe turn clothes with that. No. Reverse is the case. Most people that are even mentally ill don't even get to go out to exhibit all those things we are talking about. So, like I was saying, there was a particular research that was done, survey that was done by Abolida Florex. Now, what was this survey about mental illness? What did they think was the cause of mental illness? What actually caused mental illness? These are some of the things that she did the survey for. And when she did the survey, 34% of the people cited drug misuse. 34% said it was mental illness. It's as a result of drug abuse, misuse. They take drugs, they take marijuana, they take cocaine, and a whole, before you know it, enters their brain and that. That was 34% of people said that. 19% of the people said it was divine wrath and it was the will of God. Some of them said, yes, where you see somebody, maybe it's a punishment, it's karma that got back to that person. And it's actually the will of God, or it's divine wrath. God decided to punish the person, to make the person have that. That was what some people said. And 12% said witchcraft and spiritual possession. They say, oh, witches, witchcraft, witches have possessed the person. You know, that the person is spiritually, has spiritual issues, spiritual challenges. So you see the mindset of people. I know we are highly spiritual as Africans. We are highly spiritual. But at the same time, it is not everything is not about spirituality. It's not just centered around it. So for me, really, the stigma is personal. When we talk about mental illness, that's why I talk about it with a high level of passion. For me, it is actually personal. Some years ago, when I was, I think, about second year or third year.
Hello, ma. Hello, ma. Please, can you kindly help us change your position a bit? I think your network is not okay. Thank you.
I used to have a friend, a very good friend. We were close. We were about a circle of seven to eight friends. You understand? And the 7 to 8 friends, we were close. But when my friend Mary was diagnosed of bipolar disorder, which is a mental illness, I witnessed firsthand how friends began to recoil. The things we used to do together, they began to isolate her. Nobody wanted to sit with her in the lecture hall. Nobody wanted to be in her room, to be her roommate. The people that were sharing her room, all of a sudden now wanted to leave. I observed all these things firsthand. And I was just wondering, because I don't know, I have this empathetic side of me. maybe because of my trainings and because of the issues and challenges I've had in life, I easily get aligned towards someone when the person is passing through something. So I was wondering that behavior. People, I heard the whispers, I heard the tinglings, I heard people talking in their closets about this, about Mary. As soon as everyone discovered or heard that she was diagnosed of bipolar disorder, automatically their relationship towards her changed. And I heard the whisper, some of them would say, did you hear that Mary has gone mad? You hear them say that. Some of them would use some derogatory statements. You know, some of them will say, pardon me if I have to use. Some of them will say, she don't colo. You know, such things. Some of them will say, she has gone bonkers. Some will say she has gone bananas. Oh, I cannot be her friend again. Oh. And because I was still aligning towards her, I was still her friend. So the stigma was gradually extending to me. You know, so you ask yourself, like I asked myself that time, I asked myself, why are people treating her like this? But if she was diagnosed of maybe she had maybe malaria, or she had diabetes, or she had pneumonia, any of those things, would people actually alienate Can you hear me, please?
Yeah, just now we can hear you again.
Just now we can hear you. Yeah, just now, same here.
Okay, right, thank you. Though we have about 43 people on the platform, and I'm just hearing the voices of 3 people. All right, so as I was saying before that, so I felt very bad when I saw these things played out. Like I heard the whispers, like I was trying to say. And I asked, if someone has malaria, nothing will be done about it, and quickly will be taken to the hospital and will be treated for it. Nobody says, why do you have malaria? Nobody says uses any derogatory kind of statement. But when it has got to do with mental health, like depression, like bipolar disorder, like schizophrenia, like dementia, and so on and so on, like a post-traumatic stress disorder, and so on and so forth. People begin to use this word. So why do they use this word? Somehow, I have come to realize that when it comes to mental illness, our ignorance just makes all side of our empathy, our empathetical side disappear because of ignorance. Hence, because of what I saw happen to Mary, because I visualized firsthand what happened to her, that inspired me. I became very passionate about mental health. I became very passionate and I talked about it with all passion. Now, I have watched, even aside Mary's issue, I have watched several people struggle with depression and severe anxiety, maybe due to one thing or the other. Some, when it gets to women, I have a group that I have a lot of women that pass through one thing or the other, especially women. You know how emotional issues can really affect us in that aspect. So when people are faced with these things, all they just need is for you to know exactly what to do, to become aware, and you can refer the person to a mental health specialist or a mental health expert immediately in order to be able to sort whatever issue. It's not the time to laugh. It's not the time to stigmatize. It's not the time to go away from or to run away from or use some words. Oh, that person, that person is now mad, or the person is now crazy, or the person has been on drugs. Now, this is the effect of the drugs is playing out in the life of the person, and all those things is really, really not nice. So I am happy for this awareness that we are trying to build today. We are trying to build so that people will now know mental illness, know the things that are associated with mental illness. So let's go back to sharing the screen. Like I said, when there's any network fluctuation, it takes off the screen. So what is mental disorder? Like you can see, so many people that have mental illnesses are treated anyhow. Like you can see that little boy, they're tied with chains, maybe locked in a room. And most times, actually the parents that do that because they have been spiritually brainwashed. They've been spiritually, brainwashed is the word. They make them believe that those children are witches. And we have several of them around my vicinity. We have several of them. They tag them witches. They tag them all kinds of things because they are mentally unstable. Maybe they've had a lot of trauma growing up, and all those things put together has affected their brain. But instead of doing the right thing, sending them to a general practitioner or for psychotherapy, or even taking them to a psychiatric hospital at the worst case, so that the right people will be able to handle these ones. They end up tying them, like you can see, they end up tying them with chains, flogging them with brooms, doing all sorts of things that is uncalled for. So it is important that we know that mental health, that we really need to understand. So like when we are dealing with this particular issue of depression, of bipolar disorder, of all those things, we really, really have to be empathetic. Oh, network. The network is not helping us. That's true. I don't know why it's just getting so funny today. I don't like network obstructing me because I'm really serious about this mental health. So it causes major changes in a person's thinking, emotional states, and behavior. Mental illnesses, that's what it does. It affects someone emotionally, it affects the person's thinking, it affects the person's behavior. It can disrupt a person's ability to work and carry on their usual relationships. This is practically what mental health does to us. So let's move to the next slide. Now, these are examples of mental health, mental illnesses or mental health disorders. If you don't call it mental illness, you can say mental health disorders. We have the anxiety disorder. We have the depression disorders. We have bipolar disorders, like I said, my friend Mary suffered from. We have the personality disorder, someone that changes personality is like this, and the next time he's like this. We have eating disorders too. We have schizophrenia, and so on and so forth. These are just a few. These are just some examples of mental illnesses. So let's look at one that is very, very important, which is depression. Now, the most common cause of depression. Someone is saying my volume is low, and this is 556. How so low? Please, I need to know. Someone has just chatted that my volume is low. Is it correct? Please, can you hear me? Am I audible enough?
I can hear you from my
end. You're audible enough. Very
I
clear
can
from
hear
there.
you.
You are clear.
Okay, I'm finding it difficult to understand. Maybe it's from that person's end, because I just saw that dropped in the chat box. So depression primarily is one major cause of suicide. Every day we get to hear people jump down Third Mainland Bridge. We get to hear this committed suicide, this committed suicide, and this committed suicide. It's getting in the increase, getting rampant. Why? Because when we are able to now create this awareness, we are able to now know how we can help people that have these mental illnesses, and we do away with stigmatization. We do not stigmatize them. Some of us, if you can cast your minds back to when we had HIV, the very onset of HIV/AIDS, the very onset, so many, many years ago, you will agree with me that so many people that have died, so many people that died wouldn't have died if they were not stigmatized. Most of them didn't really die as a result of the AIDS or the HIV they actually had. They died as a result of stigmatization. They died as a result of the pressure of the society, of the community. That's what killed them. Some of them died because of thinking, oh, how will I face the world? How am I going to, oh, this person, Peter knows I am HIV positive. My manager knows, my friends know, oh, where will I hide my face and all that. That was mostly what took the lives of those people, and not actually the HIV or the AIDS. Yes, so we are coming back to what I was talking about, which is depression. Is the most common cause of suicide. Depression has made so many people take their own lives. It's the most common cause. And we need to understand depression in order for us to be able to address this suicide risk. It's very, very important that we need to address depression. What is actually this depression? What is it? That's what we are going to be looking at as we progress, because depression is something that affects so many people. You may not know. Most times, maybe the people involved don't even know that they are faced with depression, but they are going to learn as we proceed. We are just going to see what depression means and how best, if you are going through that, you are having depression as a mental illness, what are you supposed to do? We are going to learn all those things today. So now, like we already said, that depression is the most common cause of suicide. Let's see what we have. Aside depression, we also have another major mental illness, which is anxiety. Anxiety. So talking about depression, we also have anxiety, where people get anxious about a particular thing. It disturbs them, it affects them. That is practically what we mean by anxiety. We are going to learn that. Now, let's quickly move to the survey of mental health and well-being. If you look at the survey, if you look at the statistics that we have here, you'll see that about 18% of the population, global population, met the criteria for a high prevalence mental disorder. Almost 10% suffered from anxiety disorder. So you see that if it is not from one thing, it could be to another. If it is not from one, if you don't have this particular, if you don't have depression, it may be that you are a person that gets very anxious when you are doing things? Maybe you have anxiety disorder. What do you do when you are very, very anxious? That is what we are going to see. And about 10% of the people suffer from these anxiety disorders. Substantial numbers suffer from more than one disorder. That's to say that someone can have depression. The person can also have bipolar disorder. The person can also have schizophrenia. And there are situations where you have more than one mental illness. And those are comorbid situations. We're going to look at them. Good. Now, we want to look at one very important terminology, which is comorbidity or dual diagnosis. Just as I have said, that there are situations a person has more than one particular mental illness. It happens. Sometimes they could be diagnosed of don't know, are we actually praying for an issue? Because network I don't know what's happening today. Okay, so I was saying that comorbidity or dual diagnosis has got to do with more than one occurrence of a particular illness. Okay, now let's look at what happens when there's comorbidity is associated with greater impairment, higher risk. That is to say that when someone has more than one particular illness, mental illness, the person is prone to committing suicide, and the person has a greater need or greater tendency to have suicidal ideation. That's to be thinking of committing suicide. So comorbidity is not a very good thing when it has got to do with mental illnesses, because it makes the situation increase. So let's look at the prevalence of mental disorders. How often, how important, how in terms of magnitude, mental disorder. Now let's look, mental health problems, like we already are seeing on the slide. Is about the third biggest health problem in the world after heart disease and cancer. And these mental health problems are the largest cause of premature death in Africa. Like in Africa, because of the issues that we are having, like, low income, scarcity, cost of living. So people, it gets to the heads of people, especially men, our male counterparts. It gets to their heads and it affects them seriously. So in Africa, we have more of the issue of mental illness is very, very common and very rampant. So we say that the level of prevalence in Africa is higher than other places, is more in this part of the world. So hence, with all those things said, hence the importance for us to become very, very involved in the stigma of mental illness. Stigma, what I'm saying, this particular slide. We as human beings we shouldn't stigmatize. Like I said earlier, we shouldn't stigmatize people. When did this stigma start? This stigma actually started so many years ago when we used to have thieves. Maybe people go rob, you know, they go into other people's houses. And so when they get all of you, what on you, so anywhere you go, you'll be known as a thief. Anywhere you go, you'll be known as an armed robber. So people now see that stigma on you. People run away from you. People know what you are. People know you don't have any worth, and people know your history. That is when stigma first started. But as time progressed, people now began to assign this particular behavior to people that have mental illness. They stigmatize them. They stamp them. They stamp that imprint on them, such that when once someone has a mental illness, it becomes a problem to that person. So even the family is stigmatized. When they go, they point fingers at them. Don't you know that girl, the sister to that guy that used to walk mad on the streets, the brother to that guy, and so on and so forth. They say a whole lot of derogatory things, just as I told you in my story about Mary. So the stigma is what we should fight against. As we are on this platform, it is important that we become aware that mental illness can happen to anybody. And what you can do is to begin to look out for the signs. When you see the signs, as we are going to get down to it, you see the signs. If you have a brother, you have a sister, you have a colleague, you work in a workplace, you work in a hospital, or you work anywhere, begin to read the signs, begin to look at the signs. You are a wife, you have a husband that is withdrawn, that keeps to himself, that all of a sudden, you've never known him to be like that, is passing through a whole lot. That is not the time for you to move, to stigmatize, to make jest of him. No, that's the time for you to be empathetic. That's the time for you to be sympathetic. That's the time for your humanitarian side to come out. That's the time for you to lend a hand and to see how best you can help that person. Stigmatization should be taken away, because this stigmatization can stop people. That is what stops a whole lot of people from admitting to a mental illness. If I have, let me use myself in this case as an illustration. If I have malaria or I have fever, I'll readily go to the hospital and treat myself. But if I have mental illness, or if I've been depressed, as in depression, because there's a difference between being depressed and depression, we are going to get to see. So if I have been depressed, or I have depression, in this case, clinical depression, I will not just want to go to the hospital because I'll be scared. I'll say, if I go to Jesus, the whole world will know that I'm mad. Everybody will know that, before you know it, my children will be stigmatized. Don't you know, I saw so person's mother. She's the way she behaves, she now talks, she doesn't know she's now mad. Some people may even say, it's because her sins. Oh, I told her sins will come to haunt her, and her sins are actually haunting her. You know, so many things. So this stigmatization can stop people from admitting to a mental illness, just as HIV/AIDS stop a whole lot of people that have lost their lives from coming out to say, yes, I have HIV, yes, I have AIDS, and to take their antiretroviral drugs because they feel that the stigma, the world will laugh at them. So it is in this case. The earlier we begin to see how best we can cushion this effect of stigmatization, the better it would be, so that people can come out. People can go to the hospitals, people can see the psychotherapist, people can see the psychiatrist, people can begin to seek help for themselves. Everybody passes through, everyone is passing through one thing or the other. You are not alone. It is important that people that are passing through these things understand that you are not alone. You are not you cannot be an island. That 1, 2, 3. I've given you the statistics of people that in every 4 people in Nigeria. Now let me bring it to Nigeria. In every 4 people, count 4 people. Out of that 4, at least 1 has had one type of mental illness or the other in their lifetime. That's how bad it is. And the government is not really doing so much about it. Look at the amount that is set aside to handle issues of mental health. Like I said in the onset, when I started this lecture, I started this training. So stigmatization is something that we should let us not stigmatize these people, believing that it is a weakness in their personality. We shouldn't do that. Now, I want to quickly, like I like to tell stories a lot. I just want to chip in something before I move, because I want us to finish in the nick of time. I don't want to take your time. I taught in a school somewhere, some years ago. I've been in the business of education for a very long time. So I taught in school, and I had this boy, like I used to relate with children a lot. I had this boy in my class that was just brought, you know, from another school to where I worked, to where I taught. So the boy was put in my class. And as the boy was put in my class, I loved the boy. I liked his behavior. I liked how he was, and I love little children a lot. So but I observed that in the course of relating with this boy, I observed that he couldn't assimilate things the way his mates could. He had some defects. He had some challenges. And normally in a school, when a child is admitted, you have to fill a form to talk about the state of your child. Is your child okay? They'll ask sound. You take some things to show that fine, your child is good. He's not having any underlying illness, you know, which that was the case. But I observed this boy was not just as normal as every other child. So I raised I had to draw the school attention. So I had to draw the attention to the fact, to what I was encountering with the boy. And when the school authority actually looked into it, we all discovered that this boy actually had autism. He was autistic. He had that issue, you know, but the mother had filled all the forms. She had done everything. So we actually had a private session with the mother. We asked her, we invited her to school. I was there as the class teacher and the other people of the school authority. So we talked to her and we tried to see how best to get information from her. She still said, no, there's nothing wrong with her child. In fact, in the other school, he was always doing this. She cannot explain what was happening. She didn't tell us. She refused to own up to the fact that this boy was autistic. The reason I'm telling you this story is I want you to understand the severity of the effect of stigma on people. Why did she refuse to own up? She refused to own up because she didn't want the society to stigmatize her. She didn't want to be a mother to a child that was autistic. She didn't want people to know what she was actually going through. You understand? So to that extent, I was like, wow, how could a mother do that, even to the detriment of your child? Now you are concerned about the stigmatization. That is what is telling us, and that's what should tell us today, that stigmatization is very, very powerful in the lives of people, in the life of every human being. She refused to. Finally, we got to know that this child was autistic, and we confronted her with it. Because of that fear, she withdrew her child out of the school instead of seeking help, because we would have sought for help to see how to address that child's challenge, even though the child was in a general school, not a special school this time around. Would have seen how to carry that boy along, but the mother refused to tell us, to divulge, to tell us the truth concerning the child, which I know would affect that child subsequently. And I wept. The day that happened, I actually wept, because I was like, even to this extent, the mother cannot divulge the information that this child is autistic so we can help this child, just because she didn't want to be tagged or to be painted or to be stigmatized. So I want us to understand, I don't know if I'm actually making sense, but I want us to understand the severity of stigmatization. So we that have this opportunity to be in this training, let's, as much as possible, try not to stigmatize people, because it can happen to anybody. It can happen to me. I could be mentally ill. You can be mentally ill. It's something that happens. It's a part of everybody. So we should try. And it is one of the biggest hurdles that people with mental illness have to overcome: stigmatization. If you can overcome stigmatization, if you are not afraid of that, then it means everybody that is diagnosed of depression, of bipolar, of autism, will feel very free to seek help, will move forward, go out there to the limelight and seek for help without the fear of someone robbing, stamping, any derogatory messages, or the society or the world looking at them the other way. So sometimes other children, I'm ashamed. Oh, no, not at all. You shouldn't be ashamed if your child is faced with such a situation. That is why we are having this training. Now, it can also stop people from accessing appropriate help. I've already said that. People are afraid to go out for help so that they are not tagged the madman. So immense and so high is our fear of being attacked a mad person that we decide to stay and suffer in silence. Most people that have mental illness. But I pray that with this, in our own little facing these challenges now, stigma can have a whole lot of impact, can have a severe impact like we can see here. It can reduce access to opportunities and resources. Yes, because when you are stigmatized, you will be afraid to go out there, to seek for help, to go for counseling. There are people that are trained to do these things. There are people that are trained to handle this stigmatization. So they'll be scared. You having this challenge, you'll be scared to go out there to have medication, just like in the case of HIV/AIDS, because people will laugh at you, because people will tag you, they'll give you a tag. You know, it can increase isolation and feelings of hopelessness. Most times when people have this mental illness, they are hopeless already. They have resigned themselves to fate. So I'm not supposed to go out there and move with people that are fine and people that are okay, you know? So these things really affect discrimination. If you are working maybe in the office, if not now that laws have been put in place. In the US, in the UK, there are laws that are put in place. If someone has mental, maybe the person has depression, or the person has some form of mental, it's not a condition, it's not something that you should use to deprive the person of the major things of life, maybe to give the person access to expression of speech, and maybe anything goes in Nigeria. Is a free country, you know, so everything goes, anything and everything goes in Nigeria. But outside, there are stringent laws on it. So like I talked about my friend, she was isolated, she was discriminated against, she was abused. So many things can happen. So because of these things, so many people are afraid to access care. They are afraid to access help. They're afraid to speak out, to come out and let the world know what they are going through, their own detriment, just so that they are not stigmatized and people don't actually know what is happening with them or happening to them. So thank God for network. Network has been trying to cooperate a little now. So at this point, like it is not in my tradition or in my culture, I would like to pause. I like to interact a lot. It's because of network that I didn't do that. I would like to pause now. We have professionals and responsible people on this platform. I would like you to please, at this point, just maybe in the next 2 minutes, try to share 1 or 2 experiences. Is there anybody that would like to share an experience of you having been stigmatized, or you having an experience like the one I illustrated earlier on when I started? You know, I'd like 1 or 2 people to say something. I just want to know, because this is not something that is just happening to me alone. It's not something that is just related to me alone. So I would like someone to talk, to say something. Who is going to build a cat at this point? Maybe you've had an experience. Maybe you've had someone say, do 1 or 2 things as regards what we are talking about today. Please, the floor is open. I would like to hear some very lovely voices so I can be energized to continue this training. Thank you. Hello, can you hear me, everyone? It's obvious no one is hearing me. Was I talking to myself all along? Hello, MJB Manager.
We can hear you.
Okay. Thank you. Because there's nothing as bad as one talking to himself or herself. It's a very bad thing. It's even a form of mental illness when you talk to yourself.
we are with you. We are with you.
So I don't want to have that. So what I was saying is I would like to hear one or two. I wouldn't want to believe that 40 people on this platform, nobody has had any experience. It may not be yours because we are still passing through stigma. The stigmatization is not out. So nobody will want to come out and say, yes, oh, I was actually having this or having this and this happened. Okay, so you can tell us about any experience that you have had. Anybody, please, the floor is open to everyone. This is serious. Okay. It's sad.
Oh, hello.
Yes,
Hello.
yes.
Yeah,
Good evening.
my name
Please,
is,
who is speaking?
yeah, good evening. My name is Abu Kamara, and I speak to you from Liberia.
Wow, that's beautiful. Thank you, Mr. Abu Kamara, for responding, for making me not to have mental illness, for responding. Thank you so much. Go ahead.
Yeah, I'm very much grateful to be a part of this conversation. It is very much educative. But you asked about you asked about stigmatization. My concern, my concern here is that, I have not really experienced anything of church, but I have a close relative or friend who I myself have observed, because within our society, to be able to identify people with mental illness, when we are not living in church society to maybe conduct tests on them, but based on his character and his behavior. I am a driver, and I work with some mining companies, and for him, for every time he got a job, based on his attitude, he has been losing jobs on so many occasions. And what I've observed is that he is somehow mentally, defected, because he will not accept it. When you approach him on this matter, he is very much temperamental, and you cannot live in a area where every time you will want to quarrel with people that you work with, and he have been losing jobs. Even within the community, he is not in any friendliness with people, with his close neighbor. How do we help such kind of a person, as he has already, how do you call it, deny of he being, somehow mentally, ill, and it continued to affect him economically, socially, and otherwise. How do we help people of that kind if he live in a state of denying? How do we help such person?
Oh, thank you so much, Mr. Abu Kamara. Thank you for that, for sharing that with us. In fact, the issue of mental illness is something that affects everyone. Most people, like I said, out of 4, at least one person is having one mental issue or the other. Now, we are going to delve, when we get down, we are going to see how best we can help those people. But for now, let me just say this. If you have a colleague that is passing through that, this is how you can help the person. I want to believe that you work as a team where you work. I want to believe that there is an authority. Maybe there is the members of the authority of that particular place that you work. Because when a person is mentally ill, and the person, in the case of the man we are talking about, he knows his challenges. He knows that he's passing through all those things that you are talking about. At least he knows that they are not normal compared to, from the illustrations you have given me, he knows it's not normal. So what you can do in such a situation, because if you confront him, like you said, is highly temperamental, you may not know how he will eventually take it. I can imagine such a situation in a workplace. But what you can do is to raise your concerns in such a situation, is to raise your concerns to the authority, to the work authority. I don't know, maybe the managers or the people in the hem of affairs, is to raise your concerns. And I bet it's not only you that has observed that, it will be other people that have observed it. It's not actually a bad thing. The reason you are raising your concerns is so that the authority, maybe 1 or 2, can talk to him, let him understand the need for him to seek help. That's the first step, the need for him to actually seek help. Because if he doesn't see the need for him to seek help, then there is no way he can be helped. That's what I want you to understand. But if he sees that actually this is what I'm going through, perhaps he's having personality disorder. It could be that people like that, you know, or he's having bipolar, or he's having depression, or something is wrong somewhere. If he seeks help, then the psychologist or the counselors will be able to help him. On this platform now, I want us to understand something. The best we can do is for us to channel the issue to appropriate quarters, to people that will be, to the counselors, to the psychiatrists, to the psychotherapists, to the people that will actually be able to rescue the situation. Because as a person working, you are not a psychiatrist. I presume, Mr. Abu Kamara, you may not be a psychiatrist. So there's an extent to which you can help him. But how you can help him is for you to ensure that he seeks help. If it's your friend or it's somebody that is close to you, you can talk to him. You know, talk to him from the angle of not stigmatizing him, because a person that is mentally ill already, there's that issue of stigmatization. The person needs to know that you are coming with a front of not stigmatizing him or her. You are coming with a front of being empathetic, of understanding what he's going through, and making him to understand and see reason that what he's actually going through is not the normal. So by the time he understands that, good, you'll be able to see how best you can help him. If you walk up to him now in a harsh manner, maybe you tell him these things you are doing, you have lost jobs, are you not sure that you are mental, or there's something wrong with you? Maybe you are mad, you have to go and check yourself, and all those things. Of course not. You are going to get the other side of him. But if you follow him in a very diplomatic way, you make him see the need, see the reason that this is it. And if he still insists, if he still persists rather and refuses to seek help, then you have to make sure that you see the appropriate authorities so that something can be done about it immediately. When we get that, you are going to see the ways that we can help people with this issues. But for now, I guess that's practically what you can do. Do not careless it. Do not feel that, okay, I don't know him, it's just after all, what? We don't share anything. You'll go to his house when work is over, and I'll just have to stomach him the few minutes and ask if we are working together, and that is it. No, if you do that, then why are we human beings after all? So with this knowledge, you can see how best you can help him, because it can degenerate to a situation whereby, God forbid, it may go adverse and you will blame yourself for the rest of your life. So I don't know, Mr. Abu Kamara, if I have done justice to that your question. Have I?
Yeah, you already have addressed my question. Thank you so much for that educative explanation.
All right, sir, you're welcome. Please, do we have any other person that wishes to say something? You see, now I'm happy because at least one person has responded. I was thinking that this would be an interactive session where people would talk, because I have seen a lot and they are experts on this platform. So I believe I am not the only person that has seen a lot. Is there any other person? Okay, maybe others are preparing to talk.
Yeah, can I come in?
Yes, please do. Mr.
All right,
Newbert, Alex, I guess.
Yes, please.
Mr. Alex,
So
go ahead.
I think you are doing a wonderful job, and then God bless you in the first place.
Thank you.
Yeah, it's true about the lessons so far regarding this mental illness. You know, I have a colleague, or I've experienced a colleague who is going through that as we speak now. She used to teach, and I don't know how it all happened all of a sudden. You know, she comes to school, and then she started, exhibiting a strange, behavior altogether. Yeah. And they handle the lower primary, the kids, the younger ones. So she's a lady. She will go stand in front of the kids, pick a kind of play, is it bottle or tin, and then be playing as if she's done a strange something you can't really understand.
Yeah.
So it kept on for some time, and then the proprietor also observed. So it got to a point he realized no, it's becoming abnormal. So eventually he advised that she quits the job, and as we speak, she has stopped the job, and then she's home.
Wow.
And even
That's sad.
being in the
Yeah.
house, seriously, from time to time she shows up the behavior. She can just
Yeah.
get herself, take off her clothing and then just start running all around. So I guess I
That's
guess don't understand.
that's serious. Thank you, Mr. Alex, for sharing that. That's very
Yeah.
serious. And sad as well. You see, depression, if you don't seek help, one of the reasons, like I said, that people don't seek help is because of stigmatization. To be very candid, the people that she belongs to a family. She has people. So what are they doing about that? Perhaps, like I said, perhaps her people too may also fear stigmatization. How will I carry my sister? The whole world will know that I come from a lineage of mad people. Like I know, we are humans, so we know the way we talk, especially some of us. So maybe, and again, she needs to seek help. She needs to seek help. Like I have a couple of organizations that I belong to that people, they tell you speak out. For the men, speak out. It doesn't attack your virility in any form. It doesn't make you less of a human if you are facing those challenges. And it could be as a result of, before you see someone, it could be as a result of what the person has gone through in life, what the person has passed through. It could be as a result of genetics. Maybe they have in their gene, or they have a trace of that. It could be as a result of so many factors. So it's really sad. So at this point, we are going to look into, let's quickly move to the myths about mental illness. Some people think a whole lot of things when we talk about mental illness. They think that it only affects a few people. These are some of the myths that are attached to mental illness. And mentally ill people are generally violent. All this, what we have here, like you have, thank God you get the slides from MJB Management and Integrated Services. So you can just run through them. And you see, some people think that people with mental illness never get better. Please, let's mute our mics. Thank you so much. So now we are done. With that said, we have exhausted the first module. Now let's quickly move to the second module. The second module, which is depression. Like we have, it's divided into 4 modules. So now, what is even this depression? Depression is a serious mental illness, a very serious one that is important for us to know, because it happens all the time. It happens to people. Now, depression is a silent struggle that affects millions of people worldwide, yet it often goes unnoticed because of the stigma and misconceptions surrounding it, like I already talked about. So many things causes depression. So many things causes depression. So in the next 5 minutes, I want us to just take a look at this video. Let's just watch this video. It's a 4 minutes video, less than 4 minutes precisely. Let us see what is actually depression. So please, I would need to know if you can hear before I continue, if you can actually hear.
Yes, we are hearing you. Hear you.
Okay, can you hear the video?
Yeah, we can hear.
Okay, I needed to know, please. We should be able to see and hear. All right. Now it's just an A to Z, an overview of depression. So just listen, because I may not want to talk about it since our time is moving very fast. And let's move. Let's just get it.
No voice. It's not showing. I'm not hearing anything. Let's see if the video is going to be like this. Sorry, please. I can't hear at my own end. And it's like there are some other people that can't hear too.
You see, that's what I was trying to. Please, are we having the same challenge?
Yes, I cannot hear anything.
Yeah, I can hear your voice,
can
but
hear
we can't hear the video.
Yeah, we can hear your voice, but we can't listen. We can't hear the video.
Don't worry. Let's see. There's going to be a solution. Let's see. Let me know if you can hear now, so that.
Yeah, we can hear now.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. And just talking about depression and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will
All
learn
right.
about
Thank you
depression
so much. We'll
and
be
the
able
better the
to learn
treatment.
one or two things from that video. Hello.
Hello.
Yes.
Yes, you are clear.
Yes.
Yes,
Okay.
thank you.
Okay. Thank God for the. Okay, so that's the A to Z of the depression. That when people have depression, they should seek for help. Seek for help. What you can do is to see how best you can relate with those people. Let them understand the need for them to seek help. Very, very important. If you have, and when you, since we are having this training, you become aware of some of the signs when something is not just going right. Before you see someone eventually commit suicide, it takes a long process. We get to suicide. You see that if people around were observant, if they were actually able to do what they had to do, perhaps some of the people that have died by suicide would not be dead today. So practically, that is it. You are going to have the slides so that you take your time and go through them. So we have the clinical depression like we have here, that if someone has for more than 2 weeks felt sad, down, or miserable most of the time, then the person has a depression. Then with at least 4 of those symptoms, you can see the first symptoms are very, very sure that the person should have those ones. Then if the person has 4 of these other ones, either sleep disturbance, lethargy, fatigue, or poor concentration, any of them, then it is important that the person has to go check, seek help. Maybe go to a psychiatrist or go to a counselor or go to a psychotherapist or a psychologist to be able to ascertain if truly is able to combine all those factors to now diagnose tentatively, at least, that you have signs of clinical depression. So these are some of the things that you look out for. Spirits of feeling of worthlessness. People that are depressed, they feel worthless, they feel hopeless, they feel that there's just no way out for me. I cannot do anything. They are always pessimistic. They don't think anything good can come out of them or from them. So these are some of the things that you get to see. There's something we call DSM-5 criteria. That's what do we mean by DSM? That is Diagnostic and Statistical Manual of Mental Disorders. Diagnostic and Statistical Manual of Mental Disorders, the 5th edition. That's why it's called DSM-5. Now, this was a product of hundreds of international experts of all aspects of mental health. They came together and came up with this, that whatever, before you can conclusively say that a person is having depression or is having mental illness, you have to look at these factors and be able to ascertain. You don't just see somebody that is depressed, like we saw the difference between being depressed and having depression, that on the other, you are just depressed that day. Nobody can say that you have clinical depression. But depression is a more serious one that takes us go. Don't just leave immediately. It continues to stay. It becomes a part of it. It affects activities of daily living. It affects your sociability with others, your social life, and so on. When it gets to that extent, you combine all the factors with then seeking help to now be, the doctor will be able to, a psychiatrist will be able to determine if actually you have depression or you are just having a depressed day. So these are some of the things. Now, there's a difference between grief and depression. Do not mistake it. You can grieve, maybe due to one thing or the other, you just grieve. In grief, you may have a bad day or a bad moment. That's what I want you to understand. It's not every day that works out well. You may have a bad day or bad moment, but it eventually passes. It just passes. Maybe the first few hours or that day, the next day, you are your normal, vibrant self and everybody's happy again. That is grief. But depression, grief in this case, does not significantly affect your daily activities or your tasks. It does not impair your social activities. It does not. But depression is very serious. It's not intermittent depression. And it's accompanied by a feeling of hopelessness and all those things. It comes with depression. So we need to understand. So what you can do, there are referral pathways. What you can do when you see these things, like I was telling Mr. Abu that time that we'll get to it. When you see someone having all these things, you refer the person, referral pathways. You refer the person to a consultant, a general practitioner, a psychotherapist, a psychologist, so that you can help the person. Since you are not specialized, so there's an extent to which you can go or to help, but do the right thing so that it doesn't degenerate. You refer the person to a specialist, and that ends your involvement. So once you refer the person to a specialist, that ends your involvement. You are not to move around and spread the news that so person has gone bonkers or gone bananas or is mad or something. No, then to the specialist, and then we are good to go. Refer them to general practitioners, and then with the person's permission, you can consult with a specialist like Mr. Alex, I think, said. So if the person gives you the permission, like you talk to her and she says, go ahead, since she doesn't know how to seek help, if the person gives you the go ahead, because it's the right of the person to give you the go ahead, you can help stand in the gap. Since you know the right things to do, you can help talk to a medical practitioner concerning the person. And even as you are doing that, never give a diagnosis. Never go and tell this consultant that, oh, I have a friend that is mad, or I have a friend that has depression or has this. No, because you have not done, you've not carried out the proper assessment. You have not done using the DSM-5 criteria. You've not done anything. So you cannot assume or just draw a conclusion that the person is depressed or the person has depression or the person has bipolar or any of the schizophrenia or any of the mental illness too. I am worried about Mary, like that, my friend. I'm worried about Mary. I noticed she was crying. Her mood has been low. These are things you have to observe. Husbands, observe your wives. Wives, observe your husbands. Observe your children. So you can have children that are actually your own is to put food on the table. And you are moving around, you don't even know what is happening. So if you have locked the room, takes drugs, does a whole lot of things, you wouldn't know. But if you have a child like that, it's not the time to flog, it's not the time to curse, you are useless or you are good for nothing, you are this, you are that. No, it's not the time to do all those things. It's the time for you to really show that you actually have the mental health awareness, that you actually have the knowledge. So you help that child to channel the issue to appropriate quarters. That's how you can help that child. It happens to anybody, but you have to be observant, because if you are not, you can live with someone you don't even know, because you don't have the knowledge. You don't know this person is passing through depression. So these are some of the things that we need. And when you go, do not give any iota of introduction that appears that you have already diagnosed that person is not normal. No, just let the specialist do. Someone is not muting the mic and the person is obstructing us. Please kindly adhere. So we have the supportive counseling as well. Like you can see there, cognitive behavioral therapy. Those that are psychologists will understand what I am talking about. If you channel them to appropriate quarters, they know exactly what to do. Sound focus therapy, relaxation techniques, they ask them to do a whole lot of, there are some techniques that you have to breathe in and breathe out. They look for something that, memories that make them happy. Maybe they have to dig out some memories that makes them happy, and they make them to keep visualizing those memories. It tends to take away the aspect of them that is depressing them, the aspect of the trauma that they have faced that is causing depression or whatever, they attack it. So these are some of the things that we need to know. But because we are not medical practitioners, the essence of this course is not to teach you how to treat. It's just to teach you what to do and to become aware of signs and symptoms that will make you sense that something is wrong before it actually gets to suicide. All right, so we are looking at some of the myths, like we said. Some people think that depression is natural and nothing can be done about it. So they just relax and say, depression, I'm just sad. That person is just depressed. Nothing can be done. I've talked to her. She's not listening. Let her remain like that. She will come out of it, or she will do this. No, those are wrong. It's even taking her for drugs, for medication. It's not just going to work. And some of these things are myths, because medication can and does help. It does work because it helps to restore the chemical imbalances in the brain. It allows the therapist to work. It's just like you now having to take your medication. You take your medication because it helps the chemical imbalances and other aspects too. You are doing the relaxation exercises, you are trying to make yourself happy, and a whole lot of things. So if everything works together, they work pari passu to ensure that that person is fine. So these are just myths. And you know what myths are? Things that are not real, things that are not true about people's conceptions. That's what myths are. So let's see the next one module, which is anxiety. Quickly, I want to tell you a story, because if I don't say the story, I like to say it every time that I have mental health trainings. Anxiety, being anxious, what we are going to be looking at. Now, I like to always talk about myself. The reason I like to talk about myself is I have come this far, as God has made me to be into psychology, to become a doctor, to be an old. I have come very, very far. I'm a long way. I've passed through a lot, and I've actually had people that have passed through a lot. So practically, since I really deal with the health-related trainings, like caregiving, like mental health, anything that's going to do with health, just look for me. There you see me there, because I'm very passionate about human life. Those that know me, some of us on this platform, I can see their names have been my students in caregiving, so they know what I'm trying to say. You know, I like to talk more, to tell you some things about myself, so you know that we are human. When once you pass through some of these things, you know that everybody is something that can happen to anybody. So anxiety, some years ago, I had to give a presentation. That was in my early years. I just ventured into teaching. I had to now give a presentation to face my bosses in the office, to face the principal, face everybody there. I just ventured into that field anyway, as at that time. So I was supposed to give a speech. I was supposed to, like a written talk. I was supposed to talk on something. And I prepared, no doubt. I prepared for what I was actually going to talk about. But you wouldn't believe what happened to me. I was so anxious. At a point, I was like almost calling my principal to say, please, Matt, look for what to say, that please, I will not be able to take that presentation anymore, that I wouldn't be around and so on, because I was tense. I was anxious. I had that anxiety building in me, serious anxiety building in me, you know. So I didn't know how best to do it. What I want you to understand is that anxiety is actually a normal, healthy reaction. Everybody gets anxious. It happens to everyone when you are confronted with certain situations, certain life situations. You get anxious. It's a normal thing. And it occurs also when there's a perception of threat or danger, something that seems as threatening or danger, or when you have to perform at your maximum, it becomes a problem. Sometimes you get anxious. So don't, anytime maybe you have a presentation to make, or maybe you have to do something very important, you get anxious and you begin to observe certain things. Do not feel it happens to everybody. It does really happen. If not that I'm over time, I've been doing a lot of coming. But I want to tell you a story of myself, like I was saying. So I was asked to stand there on the podium to read. Could you believe it, that when I climbed the podium, when I climbed the stage to give my presentation, before I did it, my hands, my palm was sweating. It was practically as if and my knees could not even carry me. Like I was virtually shaking, and everything about me, I was like, oh my God. Never mind, Mr. Julius. Michael Julius. Mr. Mike, don't worry, we'll soon be done. I can see that it's like, I don't know if you're enjoying our your eyes are getting smaller. You are tired. I was like shaking, and my knees were like, you know, shaking.
Hello.
out. So when I sent out the air, I already felt better. Like I felt, yes, that I was better. So I held the paper now with all level of confidence and I began to deliver my speech. So why am I telling you that? I need you to understand that it happens to everybody. Anybody and everybody can be affected by anxiety, but it is normal. It is normal. So let's move now to.
We did not understand the part, or we did not understand that part. You are coming in broken.
Okay. Oh, I don't know. Okay, I was tech, but did you hear the part I said I was going to present a paper? Did you hear that?
Yes. Yes, yeah, but through the assistant, we did not understand that part.
Okay. So what practically happened, like I said, was I was fidgeting, I was shaking, and before I knew it, the paper was like my hand as if it was glaring. I couldn't hide it. And I was like, my God, what's happening to me? Why is it that this is something I practiced, but I was anxious, anxiety came. So the reason I'm telling you that story is that it happens to anybody. So what I did at that point was I took a deep breath, a very deep breath, and I let out the air. I did it 3 times and I felt a little bit stable. Another thing, another secret for stage presentation, I didn't look them in the eyes, because if you look them in the eyes, there are some people that are mischievous. So the people can just do something that will make you, you go off and forget what you want to say. So like I know, you look at the end, at the extreme end, still their eye level, whereby you are not looking particularly at anybody. So it helped me. I was able to pull through that. But I'm just saying that so that we know that anxiety is actually common. So we want to look at this, another aspect, stress. Stress is something that affects everybody. There is normal stress. Everybody feels stress. At a point in our lives, we feel stressed. We have to do something and the thing is just too much, you feel stressed. So it is, but we have the good stress and we have the bad stress. The good stress makes us alert and allows us to perform optimally. For example, when you're working towards a deadline or playing sports, this is important. You just have to hit the target. That's good stress, and you are hitting a deadline. You begin to prepare towards that. But we have the bad stress. The bad stress is actually the part that saps energy, that causes inertia, that arises when we work beyond our individual limit or ideal level. Now, our body permits me to say it in pidgin English. Our body, people say body no be firewood. If you hear people say that, body no be firewood, some people take it all the time to mean another thing. I don't want to say it because that's not part of it. But in the real sense of it, body no be firewood means that you have a limit of elasticity. It's just like an elastic. If you stretch the elastic to the end, you cannot stretch it further. There's no way you can stretch it. But if you stretch it, take it to. So humans, we have our limits of elasticity. We don't exceed them because of stress. We don't. So when we are working, we should understand that our mental health is important. And if your mental health is important, you should not exceed your limits of elasticity. Don't stress yourself beyond what it should be. Yes, we have the good stress and we have the bad stress. So let's take a look at the stress curve on the next slide. The stress curve on this slide, I believe, is visible to everybody. Please, can we see the stress curve? Are we together, please?
Yes.
Okay, fine.
Yeah.
So now, if you look at,
I can see it from my end.
Okay, all right, thank you. So if we look at this, we'll see the curve. It's just a diagram there. And this the stress that affects us is actually an emotional and physical response to pressures from the environment or internal sources. That is stress. Emotional and physical response. How do you respond? Our level of elasticity differs. Like my own level of elasticity, like my stress level may not be the same level as that of maybe Mr. Alex or all the beautiful participants and lovely participants we have on this training. We may have individual differences. We have our own different stress levels. What I consider stress may not be what you consider stress, but holistically, this is the stress curve. Now, if we look at, first and foremost, when we look at this curve, we see the x-axis, which represents that's from the low to the high. You can see where we have the low there, the LOW, the low part of it. Now, in this particular curve, the L, this where we have the low, you can see the slide of the curve. when we have the high, you can see the slide of the high. Now, the low side of it describes a state of understimulation or boredom. Maybe you want to do something, and you are not. I don't know how to. Just whether that's but you are on your comfort zone. That is where you don't have motivation. You keep procrastinating, or you lack interest in doing that particular thing. But from that low point, keeps going up, keeps performing the act, keeps going until he gets to the peak where you see the person trying to run there, the very peak as the U part where it curves on top, where the young man is. Good. That's where you have the optimal arousal and the optimal performance. That's how a human being is. Start from the low stress score, where you are just you are not motivated to do that thing. You are just on your own, your comfort zone. You are just feeling very, very fine with yourself. You are not even perturbed doing it. As you progress, as you keep going up and going up, you get to the optimal at that optimal point, that's the peak of the curve. That is where the performance is at the highest. Who is someone is writing something? One distraction is too much. Okay, MJB management, please. That's for you to mute everybody. That's may disturb us. So when we get to that point, it is at the highest. Stress levels are moderate, providing enough stimulation. You have optimal arousal. You are performing at your optimal optimal level of performance, and then the stress levels are moderate too. You are stimulated to do that work. You are focused to do it. You are doing it efficiently. That is where we have the optimal arousal there. But when you get there, you see that it begins to dwindle. When you have reached your limit of elasticity, it begins to dwindle at that point. You keep going down. You keep going down. It keeps deteriorating because you are tired. Let me use the general. Because you are tired, you have performed optimally. You are motivated to work hard and get to that point. But at that point, oh, it's like you are tired. I'm just fat out. It begins to come down. So that's to tell you that when someone reaches a limit of elasticity, the person performance down. MJB management, please, are you with us? MJB. Okay. Please, I had already craved your indulgence that we mute our mics because I wouldn't want us to exceed 8 o'clock, except unless maybe you want us to stay beyond 8 o'clock. It's fine by me. So examples. Let's give an example, maybe of low stress, procrastination or lack of interest, where you don't have interest to do a particular thing, you are procrastinating. Then the optimal level, like you are meeting a deadline. They have told you submit this work. Oh, Mr. Alex or Mr. Abu, you have to submit this for us. We need this by so time. You are trying to put in your best to do it, and you are trying to work maximally, but you get to a point whereby you are saturated. You have to start coming down, and that's where you have the high stress. Yeah, that's where you have the high stress, and at the high stress, which is the right-hand side of the curve, thank you, your performance declines. Like I told you, it declines, it comes down because we are human. So when you get to that level, oh, automatically you just have to start coming down, because excessive stress leads to anxiety. When you stress yourself overboard, it leads to anxiety. That's why people are advised that if you have something to do, take your time. You're doing it small, gradually. Don't wait until they say submit something by 2 and you are running by 1 o'clock. That's when fire on the mountain. You have to do that thing. I have to finish. You are stressing yourself. And in such cases, your productivity will dwindle. Your performance will certainly decline because you are acting under stress. So in the high stress, like you are being overwhelmed, your performance declines, and excessive stress leads to burnout. You will be burnt out. You have the fatigue. Fatigue will definitely come in, and anxiety, you'll be anxious, it will come in. So being overwhelmed with too much task, facing a high-stake situation without support, that's what's going to happen to you. So that's practically the stress curve. When know where your limit of elasticity lies, and at no point should you exceed that, because if you exceed that, you have the burnout, you have the stress, and so on. Even for our fathers, we know how much a lot you have to go through to place food on the family, on the tables of your family members, and to just keep life moving. But at the same time, mental health is important. Hence, I guess you are on this training. So now, anxiety as a more serious problem. Remember, I told you that anxiety is common, but it's normal. But when it becomes too serious, it's not very good. We have to try as much as possible to see how and what to do as regards it. When it becomes more intensive, it lasts longer, and it leads to development of fearful behaviors. This is very important. At least one major area of a person's social functioning is affected when you are anxious. Like we talked about other disorders, anxiety is very common. And so many people face this anxiety, like what I illustrated about me having that issue. Yes, mine was not a permanent one. It was like a good, well, I say a good anxiety, because it just happened to me. After some time, I was able to overcome it. There are a whole lot of people that shy away from actually doing some things because of
have issue. Tomorrow there will be no movement.
The fear, you know, of the fear of and who is actually disturbing us? This is not very okay. Modesta, Modesta, please, can you mute? Modesta, please. Thank you so much. Just help us so we can help you not to sleep here. Please. Thank you. Thank you. Oluwafemi Adekoya too. Okay, please help us so that we can do what we have to do and get out of here on time. Okay, so like I was saying, we get affected by mental health, mental illness. So anxiety is one of it. At times it happens to people. There are people that are very, very anxious. All the time they are anxious. They are filled with anxiety 24/7. You ask them to do anything, tension automatically makes them. I have a friend that anytime she has to write an exam, yes, they call it exam fever, but to me, I say it's anxiety. Anytime she has to write any exams, like we made that time, you see her, she'll be shaking. She's very, very sound, very intelligent. So you know she will make it through. You know the exam is just going to be a walkthrough for her. There are things that she knows, but she's always anxious whenever she has to write exams. And it became a problem. Any exam, whether it is test, it could even be we were friends right from secondary school. So the thing affected her for a long time that we should take note of. When it becomes severe, it becomes a disorder. Anxiety is normal. They are anxious. They have trapped by air. They have phobia for flight. For height. They have that. That's also anxiety.
We are not hearing like network. Yes,
I know. It's just that we just had a fluctuation of network. Sorry about that. So as I was saying, can you hear me now, please?
Yes, we are hearing you now.
Yes, ma'am, we can hear you now.
Thank you. A woman that is being proposed to, you have butterflies, maybe by someone you love. You know how that kind of feeling is. The women can relate more. Likewise, vice versa. You know, you have butterflies in your stomach, like you are happy and you are tense and all that. So that is anxiety, but that is a healthy one. That's something that, you know, is healthy. It's not something that is occasional. So when it becomes an issue, a disorder is when it is persistent. It affects parts of your life. So it is very important for us to know that. Remember, we talked about comorbidity, that I said that when it's a situation where someone has more than one particular illness, mental illness. Maybe you have depression, you also have anxiety disorder, maybe you have bipolar or something else. So that is comorbidity. And it affects some people. There are some people that have more than one of these mental illnesses that we've talked about this evening. So those people are very, very high risk people that you should look out for, because the next thing is suicide. When they have too many of those things, they'll start having suicidal ideations. So we have different types of anxiety disorders. We have the generalized anxiety, like you can see there. We have the post-traumatic stress disorder. We have the obsessive compulsive disorder. All these things, they are different. You can't just know it from a glance. And because I'm not in a psychiatric classroom now, I'm not in a psychology class, you know, if I were to be taking you in a psychology class now, of course, related to psychology, I'll be able to break down all these things. But for now, like I told you, we are not psychiatrists. You are not one. So, and you just need to know what to do if you're experiencing that, how to help people that are experiencing that. And also some of these medical terminologies, I don't have to really delve into it, but these are some of the anxiety disorders that people face. Post-traumatic stress disorder occurs more often because maybe people that have had issues of seeing their parents, maybe armed robber attacking their parents or coming to their house when they were much younger, maybe God forbid, or we don't pray for that, maybe killing the parents in front of them, or maybe the mother, the child watching the father being strangled, or the mother, all those traumatic, from trauma, you know. So those things come from trauma that someone has experienced over time. And because of that, it tends to make them tense and apprehensive towards many things. So there are things that we need to know, that our life centers around us. And most of the things that happen to us today and the choices we make are subsequent on the things that we have gone through. So you see someone having PTSD, you don't just laugh at the person, because the person must have gone through the things that you have no idea about. So that is what has come together to give that person trauma. Anytime the person remembers, or anytime the person has anything relating to that, it gets the person scared. Like I have a friend that they actually attacked, armed robbers attacked her. Seriously, they raped her, a friend. They raped her, they dealt with her. Oh my God, I don't even wish that for my worst enemy. They dealt with her. And that trauma has lived with her all her life, because they banged into the door, they shot at the door, they opened the door, they made much sound, you know. So she grew up with that fear. If she's with you, you mistakenly bang any object, like she's my friend, you mistakenly bang anything, or maybe she hears someone hit something, bang somewhere, or hit something hard. You see, she gets immediately, she gets anxious, she gets apprehensive. Why? Because that trauma has not left her. She's suffering from post-traumatic stress disorder. So that thing has not left her. So anytime she hears any sound, it brings fresh memories back to her. So you see, people go through a lot. Do not underestimate. I mean, I don't know how to put it. Do not, if you are happy and free of all these things that I'm saying, you need to kneel down this night and tell God, thank you. Whatever you worship, just thank what you worship, because people are going through a whole lot. People are going through a whole lot, and you see them, people smile, especially women. You see them smile, they look good, they dress up, they come out. Oh no, you don't know what people go on. You don't know what happens to people underneath the dress you see them wearing. So it is important for us to be mindful of our mental health. Now we have acute stress reaction as well. We have this acute stress reaction. Like you can see, it occurs when symptoms develop. It occurs when symptoms develop due to a particularly stressful event, usually maybe a very severe traumatic event, like we talked about earlier, something that is traumatic that you cannot forget about it. And the symptoms usually develop in case of, when we talk about acute stress reaction, the symptoms develop quickly over minutes or hours, but they usually settle down fairly quickly within days or weeks. That is not as severe as So as I was saying, now, if symptoms last for more than 4 weeks, it is important to discuss with GP, as it may have, who is a GP, a general practitioner, as it may have developed into post-traumatic stress disorder. Very important. So when people have these issues, have they picked this? I'm having training. So if now we want to look at some of the reactions that would see continued symptoms of this acute stress reaction can be anxiety, low mood, irritability, emotional ups and downs. You know, people having emotional ups and downs. Of course, we are human beings, so you know we are bound to have all those things. They just keep coming off and on, off and on, off and on like that. So, avoidance of anything that will trigger memories. They try to avoid anything that will trigger memories, that will bring it back to them, because when it brings it back to them, it's not a good thing at the end of the day. Reckless or aggressive behavior that may be self-destructive. These are some of the reactions that you see. You know, feeling emotionally numb and detached from others. They may want to be alone. They like to stay away, stay in their own by themselves, to be detached from others, to pity themselves, to worry about themselves. Now, let's look at this slide. Here, you can see a very funny slide, as we can see. How does my body react when anxious? Perhaps this is the way my body reacted the day I had that presentation that I was trying to tell you people. So many things, because it's only, they say, he who feels it knows it. Some of us have experienced it. So you know better so many years ago. And now, these days, I sit down and remember, and I just laugh, and I promise to share it today when I'm having this training. You see what happens? Look at this picture. You can see dizzy, lightheadedness, vision strange, mind racing, trembling. All these things, or half of these things, can happen to you when you are anxious. In fact, you cannot even understand what is happening to you. Like later on, you have to ask yourself, what really happened to you? These are some of the things that we see. You know, you can see the feet automatically. The leg now became like a jelly. You know, your knees. That day, my knees could not even carry me. I was so embarrassed. That tells you that anxiety is something that, but it was actually good anxiety when you're able to overcome it. But when it is prolonged, like I said, it lasts longer, then it's no more a good one. So these are some of the things we are going to get to look at them when your slides come to you, but you see a whole lot of things: trembling, difficulty in swallowing, restlessness, and so on, and difficulty in heart racing. Good. Your heart will be beating times 2, boom, 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 because you're agitated, you are restless at that point. You're afraid of fail. That's fear of failure. You're afraid of not doing it right. These are some of the things that causes anxiety, you know, that we need to look at. So let's see, general symptoms. There are 3 main types of symptoms of anxiety disorders. We have the behavioral symptoms. That's the symptoms that has got to do with your behavior. Behavioral symptoms. We have the physical symptom that people will see. They'll see you practically, paper falling. They'll see all those things. In terms of this one that I told you, that is just a mild one. But the serious one, some of us know how it feels. Then we also have the psychological symptoms as well. So let us look at the behavioral symptoms. Some of the symptoms that you see as regards behavior is when someone is anxious, the person tends to avoid places. That's how you will know. Avoid places, avoids people or situations that could trigger the anxiety. They try to avoid all those things. Good. So refusal to go outside or leave the home. Distress in social situations. People that are anxious, they get distressed where they see a whole lot of people, you know, avoidance of so many things. They avoid social gathering, and above all, they avoid public speaking. Thing that has got to do with them talking. Even if they know how to do it, they will not want to do it because they are afraid. You know, that kind of restlessness and so on. You know, some of those things, restlessness, also a noticeable inability to stay still or remain calm. These are some of the things. Fidgeting or pacing, and a whole lot of things. If you observe it, you know that this person is actually anxious. It's something that is easily observable. You can observe it and know it. Okay, we also have procrastination. Going to call my principal to say I won't be able to come that day because already I knew that I was just going to fuck up. I was just going to lose guard when I get up there because I was visibly anxious. So those are some of the things. You want to maybe put off a particular thing, procrastinate, you do it another day, or look for what to do just because you want to avoid that situation. So these are some of the behavioral symptoms that you can take. So how can you do these things? Let's move. We are going to see it. Then we have the physical symptoms as well. We have those symptoms here, like your complaints of chest pain, respiratory issues. All these things are muscular reports of aches and pains. Don't be surprised. Pains, tremors. So you know this person is anxious. Some of us that have been in managerial situations, you know you. Okay, so let's see the psychological symptoms too. The person can talk about experiences such as someone that is psychologically affected by anxiety, you know, worrying all the time, ruminating, wanting to discuss worries. These are some of the things. Persistent, uncontrolled worries. Repeatedly thinking about distressing situations like events, unable to move past events, certain things in their lives. They keep ruminating, they keep thinking, they keep talking about it. Some of us can relate more to this. Irrational fears, to feeling that their mind is racing. These are some of the psychological effects, feeling that they cannot even breathe. There are some people that when they are anxious, they cannot even breathe. They have the feeling of not being able to breathe, of not even being able to hold anything. If they hold something now, they think a cup of water or something, their hands will just be shaking. They can even fall. It can even fall off their hands because they are anxious. So these are some of the things. But if it is just mild, it's fine. But when it becomes excessive, it becomes a disorder. That's when it turns to a mental illness. All right. So we also have anxiety and confidence. Anxiety actually reduces confidence because it makes it hard to do things that were once easy, things that were easy for you to do. Maybe you are not able to do it at a point. That is anxiety. It reduces your confidence. Once you get anxious, your confidence is attacked. That was what happened to me. I kept going over that topic. What I was going to deliver, I was sure. But when it was close to when I was supposed to do it, oh no, you need to see me. I became anxious. And so it attacked my confidence. I wasn't able to deliver again as at that time, so many years ago. So these are some of the things. It reduces your confidence. It makes it hard for you to do the things that were once easy. Things that you would have just been a walk in the park for you. It's difficult, you know, but confidence can be regained by learning how to cope better and gradually building up to bigger tasks. Like I told you, that after some time, when they clapped, when they put their hands together, they clapped for me. That time I was anxious, and I gave myself a deep breath, like I inhaled enough air and then let it out. I became a bit relaxed, and I was able to handle and cope with that mild anxiety. So for extreme ones that are disordered, you can decide to learn how to cope, visit a specialist, see how best and what best you can do. Now we have what we call the Goldberg Anxiety Scale. For you watching this, for you listening to me, for those of you on this platform now, this is the Goldberg Anxiety Scale. You can take it when the slides get to you. Sit down and assess yourself even before you decide to visit. Assess the people that you know that you feel that are having anxiety disorders. Assess them. Look at some of the questions. Have you felt keyed up on edge? Have you been irritable? Have you had difficulty relaxing? Have you had difficulty sleeping? All these questions, just put it across to whoever you think is having depression, having anxiety, having a mental illness. Then when you put this Goldberg Anxiety Scale, these questions, you score yourself 1 point for each. Yes, oh, I've been having difficulty sleeping. I've been having difficulty going to the toilet. I've been restless. Score yourself. Go ahead and score yourself. The higher your score, the more likely a person or you will experience disruption in your daily life. The more likely that you are going to be having one mental illness or the other. Remember that it's not about someone getting really mad and walking on the street. So that's not the one I'm talking about. Just the anxiety is something that we should look at. I'm saying for us to have time for questions. So by God's grace, we are almost getting there. So what can you do? This is contributing factors like we can see here. There are things that contribute to the anxiety disorder. What are some of those things? Cumulative stress. I talked about stress earlier on. Alcohol or drug reactions, people that take drugs. It could be as a result of trauma that you have had, either in your youth or something that has really affected you. It could be as a result of that. Biological issues as well, medical conditions. So many things can contribute to someone having anxiety issues. What can you do? What can we do? What can you do in such a situation? Now, assess the frequency of the problem, the time, the period, the level, the frequency. Remember, depression, mental illness has got to do with how long someone has been experiencing that. You cannot just experience something once or twice and you return to your normal self and you say you are mentally ill. No, it doesn't work like that. Mentally illness must take a long time. That hence the importance of assessing frequently and knowing. Respond to immediate crisis, panic, attacks, suicidal crisis. Those are some of the things you can do. Don't close your eyes. It's not my brother, it's not my sister. It's just I don't care whatever happens. I've talked to him, he doesn't want to listen. That's his own. And you move. Life goes on for you. Remember, we are humans and you have to look out for each other. That's just the truth of it all. Investigate further, engage and talk, like I was trying to say, talk with that our able gentleman from Cameroon that I talked earlier on. Try to go further to find out what actually the problem is. See how you can help. I'll encourage the person to seek help or use self-help strategies. Seek help. Think of the things that have given you joy. Think of the things that are dear to you. Think of the things God has so given you without you buying it in money. These are some of the things you can do that when you look at it, you understand that the need for you to die will not even come to your mind. These are some of your self-help strategies. So these are some things that you can do. Show respect to the person always. Don't stigmatize. Don't laugh. Don't say, hey, I told you what you did to me. Yes, karma has finally, your village people have actually caught up with you, like some of us would say. So some of these things, we should respect the person. It's not about the illness, it's about the person. So we should first and foremost know the person is a human being before the illness actually attacks the person. So as such, we should respect the person. So these are some of the things that we can do. Now, but in the midst of us doing these things can affect. These are things that can interfere with recovery. Comfort, maybe the person sees the behavior as a comfortable one. Okay, I don't need any. It can interfere with you helping the person, just as we said earlier. Lack of awareness that anything is wrong, we said so. Sometimes these people don't even know there's anything wrong with them. That's the funniest thing. They just get depressed. They keep deteriorating, going into their shell, keep getting depressed. You know, like that. It continued. By the time they realize it's too late. Continuous stress. Oh, our men, this I'm still emphasizing, our men, our women, continuous stress. As you are working, look out for your mental health. Look out for your mental your well-being. Look out for yourself. Yes, look out for your family. Be able to read between the lines, understand, read the handwriting on the wall. When it is too much, it is too much. Because I tell you, if you break down, work continues. If you break down, life continues for anybody. So your mental health should be number one. Don't at any point lose guard of your mental health because it is important. You are hustling money, yes. You want to put food on your table, yes. You want to do a whole lot of things, yes. But your mental health is important. And there's a thin line between mental health and mental illness. When you metamorphose into depression, it is difficult. So it's better you prevent it from happening. So, and lack of purpose too. You may try to help someone, but the person has already resigned himself to fate, has already given himself or herself a death sentence. You know, so these are some of the things. These are some of the things that we need to understand when we are helping these people. Treatments and interventions. We have different ways that anxiety disorder can be treated when you have access to a psychotherapist or to a counselor or to a psychiatrist. These people are people that are trained, or to a mental health expert or even to a mental health nurse too. It's very easy. You get their medications available. Forget about the stigma on anybody that you know. Help, because help is the most important thing. What else can you do than you helping a person to overcome these challenges? Manage your stress too, like we're talking about management of stress. Manage your stress. Do not relent at any point. Manage your stress. Now, when to refer to a GP, a general practitioner. Now, you should refer to a general practitioner if a person, look at the ways and points at which you should refer a person or you should seek help for a person. One, when the person is suicidal, the person has elements of suicide, of committing suicide. You have seen the person is seeing emptiness of life. The person is seeing the uselessness of life. The person is seeing that there is no need for me to be alive. These are times that you should refer the person. The person is showing signs of severe neglect. Maybe nobody cares. The person is just no husband cares, no wife cares, like women, some of us, oh, no husband, or my mates, all of them are married, or it means I'm useless now. I don't have any life again. But you forget that that's not the A to Z of life. So these are some things that we need to know. At this point, when a person is not able to cope, is completely stopped by fears. That is when you should look for a counselor. They say look for a black goat. There's a proverb, they say look for a black goat when it's still daytime, because at night you will not be able to see when it's daytime. So now I'm thinking sometimes it affects their thinking of the signs that a person has anxiety. They are distorted, their thinking is all right, so these are some of the things that are very, very necessary for us to look out for when we've had another distortion of network, hence this slide. Okay, so as I was saying, personalization, you know, certain things that are just not right. When you see it, you'll be able to read the handwriting on the wall and know that this person really needs help before it gets too late. Remember, I told you that many people that jump into the bridge, Third Mainland Bridge, not only that bridge or other bridges too, they didn't just start. They didn't just wake up one day and say, let me jump inside that bridge. They have been small. If people could read the signs, it wouldn't have degenerated and metamorphosed into that. So before we can actually discover or conclude that a person has one challenge or the other, is when we have taken the person to see a therapist or a counselor, and this counselor has to look at some of these questions. What is the evidence for this? Is it true? Is that true? What are the chances of this happening? They have to weigh so many options. We don't just say someone has mental illness. That is why you, having a family member that is withdrawn, that shows all those signs, you still cannot conclude that the person has mental illness, except the person is checked by a practitioner. So on that note, we want to look at the last module for today, which wouldn't take us too long. We should be done with it. That is suicide. At this point, this is a sad part of it, suicide. Like I like to start by telling you, I am passionate about mental health, like I told you, because I face a whole lot. Still me, and this one me, Dr. Dorothy, still this one me, I've had a person that has committed suicide. I've had one person that has committed suicide. A man in particular, a friend that didn't know what we know now. That's why knowledge is very important. Many things that have gone wrong in our lives is because we didn't know what to do at that. So we didn't know what to do. So I've had someone that has actually committed suicide. You know, there are so many people that commit suicide that we don't even get to know. We don't get to hear because of stigmatization, like I told you. Because once they know that somebody in your family has committed suicide, or a person that you know has committed suicide, automatically you are stigmatized. You yourself that did not even commit the suicide, you are stigmatized. That is how the world works. So a death is classified as suicide, like we have here, by a coroner based on evidence, not just anything that people have committed. Has to say it is suicide based on evidence that this person died as a result of a deliberate of him or her, causing his or her own death. So sometimes people who die, they actually commit suicide, but if it is not proven, that's why we have many suicides that have not been accounted for, that have not been talked about. So suicide statistics may be higher than reported, like I said, as lack of evidence may lead to death being classified as an accident. So many dead, they say, oh, it's an accident, but it's actually suicide. Who can prove it? Of course, nobody. If there is no evidence. So that is why. So now let's go to suicidal ideation. So many people that have depression, so many people that are comorbid. Remember, I talked about comorbidity. That's what I meant by that, committing suicide. They are, and they are prone to having suicide. It doesn't happen like that. A person has is my life. Of what use am I to anyone? I just need to end my life. They start having suicidal ideas get into their heads before they actually
I can't hear you again, ma'am, from my end. I don't know if I'm the only one.
Okay, can you hear me now? I was saying that. Can you hear me? Okay.
Yeah, we can
I
hear
was
you.
saying that
We can hear you now.
thank you. That actually commit suicide, don't just do it overnight. This training is important. After these trainings, you sit down and begin to think of people that you are around you, that you have lost touch. People around you that don't like going out, with this training, begin to know, because the suicide rate is escalating. People are just dying. People are seeing the emptiness in life. People are saying life is not worth living. So if you have the right knowledge, before the signs actually get to suicide, you'll be able to know. If you're a husband and you're a wife and your husband has been going through a whole lot, and you see him withdrawn, you see the side of him that you don't know about, you see that he's withdrawn, you see certain things, begin to read the handwriting on the wall and do all you have to do when you need to do it, vice versa, even the wife. So these are some of the things like we have there. You know, they can be preoccupied with self-destruction, maybe start by slitting their body, and when you live with people that are suicidal, please make sure that you keep things away from them. If you're a policeman, you have a licensed gun, keep your gun away from anybody. In their house, you know, you have a child, you have somebody that is depressed, that have this, keep anything like that under lock and key, because these people just get ideas and they build on it. It's like a small, they lay the foundation. I'm useless. My father says I'm useless. My mother says I'm of no good. And maybe they go into drugs and they see that there's, you know, psychologically they're affected. They begin to build all these suicidal attempts. That is suicidal ideation. So when you know of it, especially parents, you get to hear that some children just died, and you ask yourself, did the parents not know all these things? So please, as parents, we are on this platform, even if we are not parents, our friends, our neighbors, let's check on them. So many things are happening to people. Let's lend a hand. Let's lend a hand and help people. Morbidity, even if it's one illness. Lesbians are affected because, you know, they are sidelined in the society. Gay people, gender diverse people, and so on. All these things, people bereaved by suicide, even those that have lost a loved one going to suicide, are prone to committing suicide because of the stigma, because people will always point finger at them. Don't you remember that Mrs. Anthony, that her brother was the one that jumped off the bridge? Don't you remember that swallowed this to kill himself or herself? It is stigma. And these people too are prone to stigma because they as the resultant effect of what they have going through. So you see now suicide statistics, you can see over there, suicide accounted for this, when you accounted for 34.8% of all deaths among young men aged 15 to 19, and so on. And drugs too also help people to be suicidal. So you take time to look at the statistics that we have here. You're going to have the slides, and you take your time to look at them. If I want to really talk about the slides, each of this graph, pardon me, we may likely exceed 5 minutes or 6 minutes thereabout because of the network being unfriendly. We have lost a couple of minutes in the different processes. Okay, so let's quickly look at warning signs of suicide. What are some of those signs of suicide? Some of them can tell you directly, I'm going to kill myself. You may have maybe a child that has been into drugs, maybe into cults-related issues or things like that. They get depression, they get anxiety, they get all these things put together. You, the parents, you don't notice, maybe because they are not with you. They can visibly tell their friends, because it's easier for them to tell their friends, I'm going to kill myself. I'm just going to end it all. That's a warning sign. Someone tells you, I'm going to kill myself. Don't just laugh and say, maybe it's I beg my guy, you are going to kill yourself. Okay, go and kill yourself now. Let me rest. No. No. If someone tells you, I'm going to kill myself, please think twice, because the person may just be saying what he or she is feeling. They say, out of the fullness of the heart, the mouth speaketh. So he may have been having the suicidal ideation and just say, let me just tell Peter, I'm going to kill myself. And you say, maybe your normal way, just look it and wave it. And there you move. If eventually that person kills himself, you will not forgive yourself. It may even lead you to having depression and having mental illness that you should have tried to stop in the first place. So these are some of the things. A suicide plan, they hatch their plan. How am I going to kill myself? What am I going to do? Where do they intend to do it? Now, I've had a friend. Let me pause at this point. I've had a friend. All these things I'm telling you is not fiction. It is reality. Like it's real. I'm not just saying friend. I've passed through a lot. That any aspect you bring it, I will at least know somebody that knows somebody that have faced it. That's the way I am. So, she was actually passing through a troublesome marriage. Like she was not having peace in her home. Excuse me. She was not having peace in her home. Her husband virtually frustrated her. And she kept quiet. She didn't tell her friend. She did not share with us. She didn't tell us. But she was just putting up a beautiful front. She drives one of the best cars. Her husband bought cars for her. It's like on Facebook. She's like flexing here and there. And people didn't know what was underneath it, that she was actually going through stress, pressure of marriage. And until when it became serious, she left the marriage at the tail end. She left the marriage. And when she left the marriage, that was when she now felt free to open up. And she told us severally that she had attempted to commit suicide. The only thing that stopped her was that she knew that government had said that anybody that is caught committing suicide, is better for you to be able to commit the suicide. You'll be free from the law. But if you are caught committing suicide and you eventually are not able to commit the suicide, and she was a military officer's wife in that case, that then they will help you to commit the suicide in the prison. You go there and stay there and commit the suicide there. So that was what stopped her. Her fear was like she didn't know whether to tie the rope up to hang herself, whether she should turn the chain. She was confused. She said many times, because of what she passed through, she attempted to kill herself. There was nobody to talk to. There was nothing she could have done at that point. So some of these things, you have to be vigilant, because people hatch plan of killing themselves. They don't just wake up and die or commit suicide. They hatch the plan. They collect drugs. They collect weapons. So if you have self-destructive children, or maybe spouses or friends or people like that, don't keep dangerous objects, because if they have hatched the plan for long, all they need is just an opportunity and the weapon to actually carry the act with conclusion. So availability of means to kill themselves, writing or drawing about death and dying. There are some people that help, they will just draw about death. They visualize themselves already in the other side, in the great beyond. And they are, you are seeing them, you don't know that they have already mapped up and to be in the other side. Their ancestors. So these are some of the things we should look at. Dramatic changes in their mood. Withdrawal from friends. If you have a friend that you've not seen for a long time, that has withdrawn from you, don't take it for granted. Go around, check your friend, find out how he or she is doing, why you've not been able to reach out. check the person, ensure the person is fine. This is important. What else can you do? Just lend a hand to humanity with this training, you know. So some warning signs: isolation from all types of support, family problems, and so rage, anger, seeking revenge. A whole lot of things can be signs for you to read and know that someone is committing suicide, or the person is planning, is having suicidal ideations. So what are some of the protective factors? Those things that can help to redirect their minds from this suicide attempt. Connectedness to family, school, community. Such people, if they have that connectivity with the people they love, with their friends, they begin to gradually see the importance of life. They begin to now see that there is no need for them to kill themselves. These are some of the things that will draw them closer, that will bring them back from the planet that they have been, or they are trying to be, can bring them out. Responsibility for their children. When they begin to see, you begin to drum it in them that if you are planning to kill yourself, who is going to take care of your children? If for a woman, they'll say you are planning to kill yourself, maybe your husband is cheating on you, or your husband is being funny, or your wife, vice versa, is a two-way thing, you know. So you want to go and kill yourself. Don't advise, okay, you want to kill yourself, okay, go and kill yourself now. No. Let them see that it is wrong. You kill yourself, who will take care of your children? Your husband is even cheating on you and you want to kill yourself. You are alive. Imagine a situation whereby you are dead. Is it not a free ticket and a free license that you are giving to the man to feel fine? You know, there are things that you can do to actually help a person, you know, that can make the person can sit down and say, it's true. I need to live for my children. I need to live for my family. You know, so many things. Good physical and mental health too. Exercises, you know, going out with loved ones, managing stress, a whole lot of things can help. Put all the resources that you've learned this evening together. You may not have anybody, but truly, if you have anyone that is passing through this, or you are passing through it, then I think you have a rethink. So a sense of meaning and purpose. Once you are able to let them know that they have a sense of living, create a purpose for them. Meaning of life. Let them know life is important, life is valuable, you know, and let them identify and seek ways to treat the mental illness. Help them. Let them also believe that suicide is wrong. Tell them suicide is wrong. You know, keep away weapons from them. Let them not have access to weapons. Keep them in a place whereby they don't get the knife to do the act. They don't have the guns. They don't have the things, or the rope, or the things that will practically aid them to carry out their act. So these are some protective factors and things that you can do. So social and economic factors that influence suicide rate. Like I said earlier, suicide rate is on the increase. That's why we have this training. I am so grateful that when I was called upon by I beg your pardon, by MJB Management and Integrated Services to take this training, I was actually happy, because the rates, the things I hear in the news, the things that keep happening, especially now there's no money, now that a cup of Gary is how much, and you know, people are going through a whole lot, and people's mental health is affected because of the economy and a whole lot of things. People are prone to going towards the suicide line if they don't have the right knowledge. Hence the beauty of this knowledge at this particular time. So we have like economic depression is also, and it influences the rate of suicide, sudden economic change, media presentations of suicide, so many things, rates of marital breakdown, like I talked about every day. Someone marries on Monday, divorces on Tuesday, and the whole thing, everything is just going, you know, somehow. So the things that social and moral beliefs about suicide, a whole lot of things have influenced people, have influenced this rate that has skyrocketed of people that are committing suicide. So these are practically some of those things that we need to know. So suicide risk assessment. Now, if you are concerned about a person, undertake a suicide risk. Now, assess if the person, if they are having suicidal thoughts. Are they thinking of killing themselves? Are you thinking of killing? Ask them, if you have such a person, don't put ideas into their heads. Don't try to rigmarole. Just ask them, are you thinking of killing yourself? Are you having thoughts of suicide because of these things that are happening to you? What are you thinking? What have you been thinking about suicide? Just go directly and ask them. Ask them. If you ask them with love, if you ask them in a way that doesn't show doesn't feel as if you are going to stigmatize them or you're going to make them feel less of a human being they are, then it's not good. So ask them in a way, in an empathetic way, so that they will know that you really want the best for them. Now, do they have a specific suicide plan? Ask them. You can be very, even if it's a, God forbid, or even if it's a child or if it's a neighbor, ask them, have you been thinking? Have you decided how you'd like to kill yourself? What do you actually want to do? Do you have a specific suicide plan? Ask them. Why are you asking them? Because I want you to understand the things people are really able to say. They are able to say out, or you observe them, will help go a long way in you killing some of the things that they want to do. If a person tells you, I'm planning to kill myself, if I see any knife in this house, because of all these things that I'm going through, I'll just get a knife, stab myself. And already the person is giving you an inkling as to the fact that you should not at any point keep a knife around him or her. That's what I am trying to say. Oh, thank you, Madam Zakaria Haruna. She's saying the session is coming up at the right time, especially in view of current economic challenges, you see. So it's important that we watch. There's no challenge that is worth your life. That's what I want everybody to understand. There is no challenge, because if it's challenge of work, if you drop dead, God forbid, today, tomorrow, in fact, tomorrow is even long. Even that evening, they have made plans of reinstating another person in your position. That's what I want you to do. If you're a husband, you die tomorrow because of things that are economic situation. Your wife will marry another husband. Don't be deceived. And you will be there. Life will still go on. She will mourn you as a good wife. But after some time, of course, the chances are she may move on. Vice versa. So when you take note of all these things, you know that hold dearly on to life, regardless of how the economic situation is. Thank you so much, Madam Haruna, or is it Mrs. Haruna, that shared that with us. So have you taken steps to get the things you need to carry out your plan? These are things you need, because why? You are doing risk assessment. You are carrying out risk assessment so that you know how best to help. If that person can open their mouth and talk to you more often, it gives you an opportunity to help him or her. That's where you can discuss, rather than someone that you don't even know what the person is thinking, or you can't walk a mile into the person's mind. You know, it is easier when you carry out your risk assessment. So risk too can be increased if the person has been drinking or using drugs, and if they have a history of suicide attempts, you know. So ask, have you ever tried to kill yourself before? Because there are people that are maybe going through bipolar disorder, or they are having one serious dementia, or they have practiced how to kill themselves. Like they have tried, like I talked about that, my friend that married a military officer. She has tried several. She said outside her house, the tank where they used to keep water, those of us in the barracks, the tank that I grew up, I grew up in the barracks, like my father, a military officer. So we used to have those tanks. She would go there with the rope and try to kill herself, but she didn't know how to do it. So such situations, maybe if she has talked to somebody, the person will try to ask her, have you tried? How many times? Or have you even tried to kill yourself before you were not able? These are risk assessments. We are assessing the risk of leaving that person on his or her own, of finding out how far the person has gone. So how do you respond? Take all talk of suicide seriously, even if they do not have a specific plan. Anytime, any issue of suicide, please and please and please do not joke with it. Somebody can call you. I really need to talk to you. Maybe somebody, you know, please, I am passing through. This is what I'm passing through. I just feel like ending it all. I'm just going to kill myself. I cannot take it any longer. Don't say, okay, it's not easy. Oh, my sister, it's not easy, my brother. You know how the world is. It's not easy with everybody. Just take it easy, and you are done with the person. Before you know, you hear the person has gone. Before you know, you hear the person has committed suicide. What will you do? Have you not played a part in killing that person? Ironically, indirectly, you have played a part. So if you have anybody call you with the current what's happening in the situation, call you at the dying hour, maybe at an odd hour, to tell you this is what, please give a listening ear. Please bring out your empathetic side, bring out your humanitarian side, see how you can help that person undergoing depression, anxiety disorder, having autism, having dementia, having schizophrenia, having any challenge. Please, at any point, do not leave that person from using these things. try to ensure that the person does not have ready access to some means to take their life, like we already talked about. If the person has a weapon which could be used to injure someone else and is becoming aggressive, call the police. Don't just let it slide. Call the police. Let something be done, or call a family member. Make sure you do your bit. Hand over the person to a psychologist or someone that can handle the situation. Do not leave the person alone. If you can't stay with that person, find someone responsible who can. Don't leave the person alone, because the more you leave the person alone, you are creating an avenue for the person to continue to build upon the suicidal ideation and definitely make it. Call emergency numbers 112 if you are outside. The person has safety contact available. The person, if any person having suicidal attempts alone. Listen with empathy and do not be judgmental. This is another aspect. Don't already judge the person. Yes. Oh, this is what you are. You sure it's not the evil thing you did that is paying you, but okay, go and kill yourself. Let me rest. Or go and kill yourself. Is it not your mates that have died? I've heard of my training. People have really talked so that there is help. Do not use threats or guilt to prevent suicide. Don't use threats. If you kill yourself, I will do this. No, don't threaten the person, even if it's a loved one, even if it's a son or a daughter, or I'm just going to end it all. I'm tired of this life. I'll just go. You sow it. You say, okay, when the person actually commits suicide, you now say, do you know that Paul told me yesterday that I was going to, oh my God, do you know that he told me? You have played a part in it. Thank God. So, as I was saying, do not leave anybody that is struggling with suicide alone. Don't let your church mind help you to help the person. So we have myths about suicide. We just have 2 slides and we are done. So pardon me. I didn't want to exceed 8 o'clock and I'm trying so hard not to. So suicide is a spontaneous act. These are some of the myths that we have. Nothing can be done about suicide. Some people, myths are things that are true. Suicide attempts are seldom repeated in their own lives. These are some of the things, misconceptions that people actually have. Suicidal persons have people that are planning suicide. We should lend a hand. We should help them. Now, the last but not the least is people with suicidal ideation. They can be considered weak, shameful, sinful, and selfish, which prevent these individuals from seeking treatment early. I have talked about stigma. I cannot say too much. If I want to talk about stigma, the way I'm passionate about this, I will talk till tomorrow. We'll still not conclude this training. I plead that in terms of stigma, we should not stigmatize people. We are all humans. If someone is going through something, don't stigmatize. If someone has told you before, when you were a friend, that, oh, I'll kill myself, and maybe I will commit suicide, and you help the person. Don't say it much later to say, this person, that person wanted to kill himself, or you stigmatize the person. No. And instead of you saying committing suicide, you should use some languages, We should avoid some languages, I beg your pardon. Like saying somebody died by suicide, not committed suicide. Rather, you can say someone died by suicide. Oh, so person died by suicide. When you say the person committed suicide, it's more of like a stigmatized thing. It's more or less like you have stigmatized. So you can say, oh, that person I used to know died by suicide. These are some of the languages that we can use. Now, a goal of suicide prevention should be to reduce the stigma attached to suicide as much as possible. So thank God, like I told you, even victims of people that have committed suicide, it is not easy with them. Do not stigmatize them, because it is a stamp that those people have stamped them in their stamp on that family forever. People will be talking about them. But since we have this training, we have this knowledge, it will go a long way if you are concerned. And risk factors are present. Ask if the person is suicidal. Try to ask. That's important. If yes, assess whether the person has a plan, the means, and the person has decided, even on the time that the person wants to carry out the act. You need to act. Refer the person immediately to a mental health service, an emergency medical service, or ring the police. So, in a nutshell, summarily, as we conclude, this is the end of the slide that we have for today. As we conclude today's session, remember something, that mental health is not a destination. It's not. It's not a destination. It is a journey. Like a journey, you take one step, you travel miles. That's how mental health is. It's a journey. Every step you take, no matter how small, brings you closer to a life of balance, a life of resilience and fulfillment. Be kind to yourself and be kind to others. Seek support when needed, and never, ever underestimate the power of your own strength and compassion. Never underestimate, never say, I cannot do anything. I don't have the power. I don't have the, no. Never underestimate the strength of your compassion. I mean your strength and your compassion. Together, we can break the stigma. We can support each other, and we can create a world where mental health is prioritized. You know, this world, mental health is not prioritized. From what I have told you, the government, so if they are not prioritizing it, you prioritize it. Let it be of priority to you as an individual, your own mental health. Together, we can break the stigma. We can support each other, and we can create a world where mental health is prioritized and celebrated. When people are mentally okay, they are celebrated. You have the power to make a positive change. Starting today, since you've had this training, let's walk this journey together with hope and with courage. Let's just take the walk together, knowing that with God, all things are possible. That we'll try as much as possible to help reduce the incessant prevalence of suicide, of people having depression, of people having anxiety disorders, having all these issues. We can help them, and let's consider them humans just as we are human. So at this point, we have actually come to the end of today's training. And I don't know, I've seen a couple of statements. Okay. Thank you. I'm having beautiful comments. So we've come to the end of today's training. Someone is saying I should put a face, and I don't really get that. So having come to the end, at this point, I would like to ask if there is any question, or there is, oh, thank you. I'm so happy. The comment I'm getting, beautiful and wonderful comments. So if we do ask, like Ruth Ajayi is saying, Danjuma, Moses, Victor, everyone, Mr. Alex, Mr. Abu, everybody, we do this thing that we have learned today. Small, in our own little corner. And you'll be surprised at how much the effect will be, the impact will be in the society. So do we have any question, please? Do we have any contribution? And from anyone, I'd like to take questions. And if I don't hear someone contribute, finally, before we leave, I'm not going to be happy. I want my mental health to be,
Yeah, I have a question.
So I've seen some comments in the chat box, but I'll please, who has the question? Go ahead, sir. Please.
Okay, how can a military man or military personnel handle mental health?
Okay, a military personnel. Okay.
Yes. Yeah.
Fine.
Any tips?
Thank you for that. Yes. Yeah. Thank you. That's a military man handle personal mental health. Mental health or mental illness?
No.
Which of
how can you know, because of the fatigue and the post-trauma.
I get you. I get you. I wanted to know, the reason I asked is, how can you as a military man help another person that has mental illness? But in this case, you are talking about a military man himself. That's how you can help your own mental health. Okay, like I said, my father was of blessed memory, was a military officer. So I lived part of my life in the barracks. So I understand what you are trying to say. Military people, naturally, they tend to be depressed. They tend to not depressed, but have depression because of what they see, what they have to be, what they face practically. And you know, because by nature of the fact that military people have to be strong people, agile people, they find it difficult. I think they must be about the worst set of people in this case. Like, they will not feel free to express how they feel because they see it as weakness. And in fact, if a military person comes out to even say that this is what I'm experiencing and this is what I'm experiencing, he's funny to the society. They may think that a military person, you should be all as strong and all that. So these are some of the things you can do, sir. You can take time as a military person. I don't know if it is for you, but you can take time to practice some techniques. You can take time to relax with your loved ones. You can take time to do exercises that will refresh you. You can take time to stay with loved ones. Those are some of the things that will help you erode some of those memories, especially military men that have fought Biafra War. Most of them are prone to depression because, like, my father fought Biafra War, and he always gives us a clip and glimpse of the things he passes through. So those can lead to post-traumatic stress disorder. They can be affected by some of those things, maybe watching people die, maybe the war front, and a whole lot of things. So how you can do these things, aside seeking help if it degenerates into mental illness, that is for a counselor or psychotherapist, for yourself, so that you remain healthy, you have to ensure that you do carry out certain techniques. Take your time with loved ones. We are all different people. The things that matter to you, if you feel happy when you are aligned with your family, when you are with your children, try. Relaxation techniques will help you. Exercises will help you. Mindfulness will help you. Seeking support where you know that you have any challenge, seek support. It doesn't affect your virility. It doesn't affect your boldness, the agility as a soldier. Reach out to people that could be of help to you if it escalates or it gets into if it metamorphoses and you are facing depression or having anxiety disorder. Then above all, to monitor your stress level, monitor your own stress level, because military people are prone to being stressed. Duty calls all the time. You have to be agile all the time. So you have to create for yourself. Somebody say, even if someone does not create happiness for you, create for yourself. Do those things that you love to do best, because they will help your mental health. And at any point that anything, like Bible, I don't know, some of us, I don't really know much about the Quran. The Bible says that if one part of your body makes you to sin, cut it off. So as you are walking, you are gauging and looking at the things that are affecting your mental health, the things that are weighing you down, stress, everything put together, anxiety, weighing you down. Then you have to do those things that will ease it by you getting yourself doing exercises. There are a whole lot of them on Google. If you Google it and check, you are going to find out so many exercises. For women, you can do yoga. When you do yoga, it relaxes your spirit, it relaxes your soul. There's how you feel. You begin, you are relieved of some of those things. So as a military person, take some time out with family. It's not all about the barracks. It's not all about duty. Take time and relax. Sit down, admire nature, do the things you know how to do best. When you do that, it will help you to loosen the stress that could result in mental illness and so on and so forth. So, sir, I think I have actually done justice to your question. I need to know. Is that okay, sir?
Thank you very much. It's okay.
Okay. So, please, do we have any other question or anything to say? Because you know,
yes, I have a question also.
So, there are hands raised up. I don't know if you can attend to people.
Okay, all right. Please, just a minute.
Okay.
Let me see. Okay, I can see them practically. So please, can I start with Mr. Martin?
Okay,
So
I already made some
Nwakego.
Yeah, thank you. Nwakego,
okay,
Martin.
Go ahead, sir.
Okay, so I already made some comments in the chat box, but there was one that you said you didn't understand. I meant if you can see your face. I mean, if you can display your video, let's put a face to the wonderful presentation. Yeah.
Mr. Martin, you are really funny.
Okay, so you also made one comment about yoga. And I know there's a myth concerning yoga. I don't know what your opinion is on yoga.
Okay, spirituality. Go ahead, sir.
Yes. I just want to have an opinion that you can share with us concerning yoga exercise. Thank you.
Okay, you want me to explain yoga?
Pardon, no, Mr. I said there are some myths concerning yoga.
Okay, so myths concerning yoga.
I don't know what your opinion is. If you have
Okay.
a better explanation to give to us concerning
Okay.
yoga.
Okay. Okay, sir. You see, what I actually, the myths you are talking about, I don't know if you can share one of it, because I know that yoga, some people don't do yoga because it's a spiritual, they feel that yoga has a spiritual undertone to it. I don't know if that's one of the myths, Mr. Martins.
Yes, that's it.
Can you hear me, sir?
I can hear you, sir. Emma.
That is
so that's it, yes.
Okay. So some people think that it has a spiritual undertone to it. But for me, like I said, it depends on what you believe in. It depends on what you actually believe in. If you don't feel comfortable with it, yoga is just about one of the things that you can do to relax yourself. So me, I know that some people have that opinion of say, yoga. Only women practice yoga. There's some myths about it. Some people say that it's only women that should practice yoga. Some people say yoga is dangerous. It's dangerous. Yes, thank you. Yes, people say, some people say. Thank you. Okay. Yes, that's what I'm saying that. What we mean by myth. Is echoing. I hope they are good. Can you hear me?
Yes.
I think it's network.
It's a general network problem.
There's somebody that the mic is on. Techno BF7, your mic is on. Please mute it.
Please, can we just put off our mic? I'm going to take all the questions. I assure you. Please, let's put it off so that we will not have. I don't intend to take your time. Maybe we'll hit 8:30 and then we'll stop. So it is actually true. Some people believe that yoga is dangerous, but the fact is that yoga is not any more dangerous than any other physical activity. That's the way I see it. That's the way I see it. I'm not a physical educationist. Like, I'm not a therapist. Physiotherapist, so I wouldn't know in terms of that. I know that there are some myths. People say that it is dangerous. Some spiritualists, others are attached to maybe the spiritual aspect. Some people say only women practice. So the bottom line is it depends on what you believe. There are so many things that you can do. There are so many techniques that you can follow. There are myths practically. Some of these things are myths. Some people know yoga is actually beneficial and it's not dangerous. That's what I think. If practiced with dedication and initially under the supervision of an experienced teacher, it will teach you a lot of things. It will teach you, that's my own opinion. So if you're a highly spiritual person or you believe that it is dangerous, well, I wouldn't know about that. But me, yoga is relaxing. That's why I say in everything, you pick the things that suit you most, the things that aligns with you most, because we are all different individuals. I think that should be that. Do we have any other? I don't know, Mr. Martins, am I good? Move to the next person.
Yes,
okay,
yes.
Mr. Daniel.
Well, please look at our chat. At the chat.
Sorry, ma, can I say something?
Okay, I'm coming. This teaching is very expository and very okay. Thank you. Thank you. It tells a lot about you. Thank you. Okay, madam, you can say something. Who wants to talk so that we have the...
Okay,
who is talking?
Talking about...
Abimbola. Who is talking? Mercy.
Mercy Victor.
Okay, Mercy.
Okay, I just wanted to... Yoga is not good for you. You can listen to music. Music helps.
Thank you. Thank you. That's why I say what works for you. Whatever works for you. What works for me may not work for another person. Like I'm saying, I do yoga a lot. And when I want to relax, I do yoga. So some people feel the spiritual aspect of it. So whatever works for you, there are a whole lot of things that you know what to do. Like when you want to relax, there are people that when they want to relax, they just go outside and go through nature. They sit down and look at the skies. At times I do it. I just want to relax, want to be refreshed. I go out and just look at the stars in the sky. I admire nature a lot. Or I go to the beach. I go to the beach and just sit around and just look at the water, the waves of the water. It makes me really, really connect with nature. So that is, it depends on what actually suits you. So thank you so much, Mercy. You see why I said very knowledgeable personalities on this platform. So you can also listen to music. Do exactly what you know relaxes you, because what relaxes me may not be what relaxes you. Thank you. Who else has a question? Mr. Daniel, can you ask your own?
Good evening.
Mr. Daniel.
Good evening. Can you hear me?
Good evening. Yes, I can hear you. Go ahead.
Thank you for the wonderful presentation. Mine is just a quick one. Though I have a lot of questions, of which you have answered virtually almost all of them, but I have one that needs clarification for me. You talked about Goldberg anxiety scale during your session.
Yes.
Yes, and you have stated some questions that they are going to ask the client, that if the client is suffering from or is experiencing some certain action or state and like that. So I'm working in Borno State, in northeast part of the country, Nigeria. So, and in my work here, there is a form that I am using in assessing the psychological state of my client here. And the form is DAS-21. That's depression, anxiety, and stress scale. It comprises of 21 questions that you are going to ask the client. So now, under that, your Goldberg anxiety, I think it's just Goldberg anxiety. It addresses only the anxiety scale of a client, right?
Correct.
I understand that.
Yeah, right.
Scale.
Goldberg anxiety.
Okay.
Yeah.
So
okay.
Now,
go ahead, sir.
Okay. So now, in using that tool in assessing the anxiety scale of a survivor or of a client, is there any measurement? Like just like the DAS-21, it has like 0 to 3. Like 0 is no, little or no, while 1 is somehow or mild. The 2 is it moderate, and the 3 is severe. So under that anxiety, is there any scale that we can measure, of which if the client falls under severe, we can refer the person to a mental health specialist?
Okay. If I understand what you are saying, first and foremost, I want to say that the Goldberg anxiety and depression scale, sometimes in this case, it's just Goldberg anxiety scale, not the depression one. We have different types anyway. So it's simply a diagnostic a tool that is developed to find out the probability that a state of anxiety or depression will occur in a person's life. Now, like when I started this training, I did say, if it is 0, I don't really have to. That's what you are asking me to really say, is because you are into it proper. Like you are, perhaps you work with people, you know, you work in, I don't know, where did you say you work, Mr. Daniel?
In Borno State, with one of the humanitarian organizations as a psychologist.
And that's exactly why you're asking me this question, because you work with a psychologist, like you have the direct interface of what happened. This training is not actually telling, is not really or talk assessment is carried out. The client actually comes, and that's a proper thing for a psychotherapist or a counselor or a psychologist to do. But for the purpose of the way the scale is designed is, like we already had it there in our slides, when a client tests to more than one of this, let me quickly, pardon me, and let's see how to quickly. If 10, 1, 2, 3 out of maybe 12, you are able to test yes to a higher number of it, then they're going to have an anxiety disorder is maybe like 80%. So it's actually just as you said, to access and know. for us, we can also stay, like any other person can also just stay using this slide and ask yourself this question. Have you been worrying too much? Have you been irritable? Ask yourself and then give yourself your own scale. All the scales, all the measurement is not cast on concrete. Really, it differs depending on the particular kind of Goldberg anxiety scale that you have. So it's either a 0 for no probability, you move to 1, you move higher, higher, higher. The higher you go, the higher the chances that there is a probability that you are going to have that anxiety disorder. So I don't know, Mr. Daniel, any other thing aside that me delving properly into it, it means I'm going to be giving a psychological lesson, our psychological course this time around. So I don't know if I have time to do justice to that question, sir.
Yes, ma'am. Yes. Thank you.
Okay.
You have answered everything. Thank you.
All right. So do we have any other person? Let's see. I cannot find any hand raised.
Sorry, I have a question on the chat.
Okay, in the chat. All right. Organizations need to take mental health.
I have a question also.
Okay, I'm coming. Just a minute. I haven't seen that on the chat, so maybe you can ask the question. Okay, go ahead, sir. Ask your question. Because I'm trying to look at the chat. I haven't found. Ask your question, sir. Tell us your name.
Okay, thank you. My name is Jimmy, Udo Jimmy.
Okay, Jimmy. Okay, Mr. Jimmy, go ahead.
Yeah, this actually was a practical experience that happened in my church. So I want to know if it has anything to do with a mental health issue or not. We have this young lady who came in and was very vibrant, attending to responsibilities and all. But because one day she was judged or more or less condemned by her appearance and the kind of dressing in the church one day by one of the elders, she just, from that moment, cut off from everything. She would not even want, although she will still come to church, appears to be very happy, but she doesn't just want to do anything that has to do with maybe activities or involvement anymore. And we've tried to talk to her. She says she's fine and all of that. So I just want to know if it has anything to do with any mental issues. Whatever happened really got to her that she couldn't help it anymore. And so what else can we do to help if actually it is?
Okay, sir. Coming from what you have said, like I said, in the course of the training, we cannot just conclude that the person has mental issues unless we have carried out certain we've carried out our own assessment. Now, in that situation, you said, I want to believe that I don't know the person, but I want to believe that it is more of an attitudinal issue. Now, according to you, that she did something that she was reprimanded. Am I right, Mr. Jimmy? And maybe she was
yes.
She actually did something
the approach probably was not too good to her.
Yes, I understand. She did something that she was reprimanded. So, and the way she was reprimanded was not the proper way. That's why I say it's more with which she was I don't know. But to me, from what you have just said, that shows little illustration. She has never been like that up until then, and she's not exhibiting anything that is overboard, like maybe with being abnormally and so on that are close to her. But again, you are not close to her. Maybe if it's somebody that is close to her, they will be able to know her one-on-one. If she's okay in the house, if she's okay in every other thing. It's only when she comes to church she exhibits that kind of behavior. Then it's
she's okay in the house.
So it's not illness. It's not a mental illness. It's just an attitudinal issue. She's not feeling happy about the way she was, and she's feeling that if it's not her, then nobody should do that work. And the way she was, after all, why should they talk to her like that, and so on and so forth. So that one is an attitudinal problem. I to a large extent, 70% believe that it is not a mental issue. Yeah, thank you.
All right. Thank you.
Okay, so anyone else? Someone said he asked a question in the chat box.
Yeah, so I'm the one. Yeah, let me say thank you so much for your time and your
You're welcome.
Yeah. So my question is, looking at the seeming lack of support and attention that's given to mental health and people with mental issues.
Illness, yes.
At different levels of government, whether at the states, federal, or LGA. What do you think is responsible for this? But beyond that, I think that strong advocacy for attention to be given to people with mental health and mental health as a whole will really help us change this narrative, because it seems that I don't know. Well, I'll wait to hear from you what you think are responsible for the seeming lack of attention and support. Thank you.
Okay. Thank you so much. One, to me, like I already said, number one challenge is that stigmatization makes the people that are actually affected by this issue not to speak out. As such, we are not able to get statistically the high prevalence in people having, I don't know if you understand what I'm trying to say. What I mean is, one of the hitches is that we are knowing the statistics now because we are on this platform. So many people are passing through this. They refuse. These people don't seek for help. They don't come out for help. That is one. Secondly, the government does not see it as something that is important. The people that I have, by the grace of God, I've really had a lot to do with people out there when it comes to mental illness. And I've observed that people that are wealthy, people that have the resources in countries that are not low-income countries, that there is money and all that, they handle it easily because people have the money to see counselors, they have the money to see physiotherapists. But in low-income settings, people don't understand, just as you have said, advocacy, people don't understand. Government does not understand the urgency and the need for them to do more, like to apportion more funds in that. Because when you look for a psychologist, it's not free, of course. Then you tell a man that is passing through depression that cannot buy maybe a cup of gari that is now a 500 naira a cup in my own part. You know, you are telling the man to go and pay so amount of money to be able to access a counselor or to access a therapist. It's most important. It's impossible. So one, it is the advocacy, it is the awareness, like we are trying to do on this platform. Now we have about how many people on this platform? You can do the advocacy in your own little corner. You can talk. You can let people know if you are in the hem of affairs. Like I have many ogas on the top, ogas on top in this platform as I'm talking that I don't even know them. So the ogas on top can help us meet the ogas on the very and let them see the need for people to be for more funds, for more awareness to be created, because even some of the people that have this issue, they don't know they have the issue. So that's the awareness problem. So advocacy, we should have more institutions. There are many foundations that go into that. Like I speak, I actually have a group, like an organization that handle these challenges in my own little way. But of course, I cannot do it all. So we need more people understanding the importance, because when they understand the importance, it will now generate in them creating more avenues and opportunities for people that have this challenges to be able to come out. And as much as we try to stop stigmatizing the people, we kill the stigmatization aspect of it. It makes people to come out ready and available to speak out when they are faced with these challenges. So you've said it all, sir. It is just the issue in the advocacy and the awareness. Still, we need to still create the awareness. There has to be, we used to have, I think sometime in October, if I'm not mistaken, World Mental Health Day. On those days, so many things are wrong. Even ILEN is going to have, I beg your pardon, MJB Management and Integrated Services is going to have this training sometime again when we, in October. That is when we have the World Mental Health Day, that everybody will now, it will now be on media. Everybody will now want to know what is even this mental health. Why are they giving it a day? And so on. People begin to be aware. So it's our own duty having this training. We should create the awareness. Offices, organizations should have a mental health trainings, awareness. Should they let their staff be aware of their mental health? They should take it seriously as they take care of their physical health. When they have fever, when they have this, they go to the hospital. So they should be conscious of their mental health. These are things that we need to know. So I think I've been able to answer that to an extent.
Yes, you are. Thank you so
okay?
much. Thank you.
Who else has a question before I hand over? And then before I leave, actually, there is a group that is created for this class. Now, that group is an open group. What I know about BCC UK, that's Blessed Cosmopolitan College, the people, and since it is subsidized so that everybody can get the certificates. I want to tell you something. There is a difference between you having the knowledge and you don't have what it takes to when the need arises, use this knowledge. It's like a farmer that knows how to fail. How far can that farmer go? So I crave your indulgence, those of you on this platform. It is important, as you have had this training, it's very important that you have a certification that you others concerning mental. When it comes to mental health issues, you can help. You need that certification because you can school mental health counselor. You can talk to students. You can go to universities. You can work. You can talk to your staff. You can do a whole lot with the certification, the certificate you get from this training. I'm not trying to blow trumpet for MJB management and services, but I'm just trying to tell you that if you don't have the certificate, please do, because I can assure you that you will use it in the shortest possible time, and you need to have it so that when the need arises, you can have what it takes to actually go to the farm with a whole. So on that note, I don't know if anyone has any question. If you have any question, please drop it on the.
We requested you show us your. We wanted to see your face, madam.
So someone wanted to see my face. But,
yes, please.
Please, can we get the PDF? Sorry.
Someone is asking my professor now.
Can we get the PDF material? Because
my face. Do you know yes. Do you know if I am mentally ill?
Hey, the line is breaking. We can't hear you.
The issue is this: you can reach out to me anytime, at any time. I hold a doctorate degree in psychology. I have a PhD in psychology. Someone asked of my program. I'm trying to say that I have a PhD in psychology. I have a woman with many sides. I have been a mental health advocate for some time. To me, currently, I just finished a training on.
This better part, we didn't hear you too.
Oh, thank you very much. Thank you very much, everyone. Really appreciate you. I don't know what happened. Maybe she's having network issues. I want to thank everyone for taking out time to attend this course. We really appreciate you here at MJB Management and Integrated Services. Now, this payment for the certificate is still on, and everybody that have paid, as I told you earlier on, based on our advertisement and everything, that the lesson or the lecture as we just finished is free of charge, but the certification is what you are going to pay 10,000 for. So on that note, everybody that has paid, your certificate will come, the studies, the slides, the materials will come together anytime from now. If there's any other question, I want to call it a day. Do we have any question?
Yeah.
Do we have any question?
I have a question.
Okay, Mr.
Yes,
Abu,
I
go
have
on.
a question. Yeah.
All right, go on, Mr.
As
Abu.
as relates to the payment, How do I
Yes.
do my payment? I'm from Liberia.
Okay, you're from Liberia. Okay.
Yeah.
What the country where you reside? You reside in Liberia?
Yes, I am living the capital. I'm in Monrovia, Liberia.
Okay, all right, all right. The platform is still on. We'll check that and we'll get back to you before tomorrow. We'll put it on the platform so that you know what to do.
Please, I have a question.
Okay,
I'm
Mr.
in Ghana.
Newben.
Yes, please. How much do I pay?
Okay, it's 10,000 naira. It's 10,000 naira for the certification.
Okay, that's what I mean is I'm in Ghana, so I would have to convert and then pay into.
Okay, you know, we'll have to check. We'll check that. We'll check that. We'll check that and put it on tomorrow. From now till tomorrow.
All right. Thank you so much.
Okay, you're welcome. Any other question, please, before we call it a quit?
Yes, please.
Okay, go on.
Yes. Are we getting the certificates? Are they going to be sent to our email addresses, or they're going to be sent to our WhatsApp WhatsApp? Yeah.
You'll get it through your email, the electronic media. You get it there.
Okay.
Yes.
All right. Thank you.
Okay, thank you too. Any other question? As we are about calling it a quit? Yes, doctor. We are about calling a quit. Yes.
Yes. Sorry, I was lost at a point. I think network. So pardon me, just give me 2 seconds. I was talking before I went off. Someone asked a question in the chat box, so I was trying to respond. So I said that it's I wouldn't be able to show my face this evening. You can drop your questions in the group, the mental health group. At any point, you drop a question, I'll ask for permission from MJB management to respond to your questions in case we don't have time to complete the questions. So on that note, I want to thank everybody for being cooperative, to have cooperated with me, and we've come this far. Thank you so much. Over to you, sir. MJB.
Thank you so much, Dr. Dorothy Kingsley Etugudo. I was just telling our participants that you've been wonderful, and they attest to that you have been wonderful. We appreciate you so much here at MJB Management and Integrated Services. As I was talking, if there's anybody, you have any question, I thought Mr. Oyeleke Johnson, you were trying to ask a question.
Yeah.
Okay, sir, go on.
Good evening. It's
evening,
a very
sir.
good and wonderful presentation. I would just like to chip in some things that I found also as a clinical psychologist. I want us to look further on the age bracket of people that commit suicide in Nigeria. And also, what are the factors that is responsible? For example, these days we have the youth committing suicide. What are the factors?
Yeah, we had it then.
I know. And from age bracket 30-45, what are the factors? And those above that, what are the factors? Like yesterday, I was on a radio program, and this thing was raised. And I have to say that, okay, I know that the parental factor is there for those students that are committing suicide nowadays. From clinical practice and from other things, I discovered that. Also, but I just want to say that in further presentation, let's have this age bracket and to know what we can do. If it is the parents, if it is the colleagues, if there's the work ethics or whatever. I work in a place that I discovered lately, the issue of stigmatization. When I got to that place of work, there's somebody that had this problem of mental illness, and actually it's just a kind of depression, but she was labeled. And with that, because of that, they have to sack her in that place of work. What can we do in this country? Because it really pains me. They are supposed to be mental health, in the mental health bill of Nigeria. Something must be done, because this person just lost her job without, he just make a comment on the WhatsApp group. And that comment was not something, but somebody said, that person should not hear her because she's mentally ill. And eventually the thing got to the authority. They have to ask her to go. So these are some of the little things that stigmatization can, it cost her a job and brought a lot of other problems to her. So please, if we can have input in the bill on stigmatization, it will be of help to everyone. Thank you very much.
Thank you.
For
Thank
hearing.
you, sir. Sir, let me, we said we will not, but let me just say something, Mr. Oyeleke. I'm so glad you brought that up. You are speaking from experience because you have, because of where you work and all that. So like you talked about the age brackets, I had said earlier that in the course of the slides, those of us that saw it, there were slides that had the graph of the ages of people that are having depression and suicide and so on. We had the graphs, but due to time, I didn't delve into it one after the other because network disturbed us and I didn't want to exceed it. So thank you so much. So I think the government should do something about that. Mr. Kusang Nyang, you wanted to say something. You said, can you speak, Mr. Kusang? Or is it a lady?
Yes, it's a lady.
Okay, madam. Okay. Thank you.
Okay.
If you look at the prohibition against disability, if you look at the Prohibition Against Persons with Disability Act of 2019, which was enacted in January, it says that any discrimination against a person because of the person's impairments by any organization or that the law is both, you can take a civil action and a criminal action, against the organization. You sue the person that committed that act against you, and then you also sue the organization. And I think it's about ₦1 million, minimum of ₦1 million. For training.
I've lost you, madam.
Disability. We know that's meant. So I think we should also look at that. And I agree with him. We need to create more awareness within the organization, because if the organization or the person knew that she could actually sue,
she would have done then. Yeah, that's right. That's right. So they say people perish because of lack of knowledge. So if you don't have the right knowledge to do what you have to do, you wouldn't know. So awareness is very important. Thank you. Thank you, Madam Kusang Nyang, if I'm right. So that's for that. MJB.
Yes, doctor, I'm here. Okay. All right.
Okay, so practically that's how far we have come. Any other question, please just drop it in the group. That's a group that is there that is created by MJB Management and Integrated Services. Any information, if you drop a question, I'll respond to the question. Thank you so much. Some other day you get to see my face. Thank you so
much, Doctor. Thank you so much, Doctor. Thank you for responding to those questions. Before we draw the curtain finally, I want to know if there is it concerning the certification or any other thing. If there is, I don't know whether there's any question concerning the certification and any other area. All right. Thank you so much, everybody. We appreciate you so much. Do have a lovely night rest, and God continue to be with you. Be safe. Bye.
Bye-bye. Thank you.